the Hertfordshire Safeguarding Adults Board. First of all, I'd like to complete the formalities of making an announcement on COVID-19. Due to the coronavirus pandemic, the Council will be holding this meeting electronically in accordance with the relevant regulations. Members of the public may also attend this meeting in an electronic capacity, and there is a link on the Council's website for them to do so. Members of the topic group are asked to keep their microphones switched off until called to speak, and to switch their microphones off once they have finished speaking. Cameras may be left on throughout the meeting if members wish. If you experience connection or other technical issues, it may help to switch your camera off. Cameras should be switched on if and when speaking in the meeting. To indicate a wish to speak, members should use the raised hand function. Members will take all evidence over the course of this meeting. Whilst there is some flexibility built into the timing of the programme, it is crucial that we hear from all the witnesses. The programme is planned to provide a balance of presentation and questions, and to facilitate this, please ensure that all questions and responses are succinct. At the end of the scrutiny, recommendations will be formulated. A short report will be produced of members' conclusions and recommendations. The implementation of the recommendations will be monitored by the Impact of Scrutiny Advisory Committee approximately 6 months after the report is published. To assist members, the scrutiny officer will summarise the contributions and the conclusions reached by members after impact from witnesses during the programme. Confidentiality. Scrutiny is held in public, and any evidence produced will be available to the public. Issues of a confidential nature should be framed to protect a patient or client's anonymity. Breaks of at least 15 minutes will be held every 2 hours, will be taken after a speaker in the debate has finished speaking or incorporated as appropriate. The other point we shall make is we will be asking witnesses to restrict their presentation to within 10 minutes. Some of the slides are quite comprehensive, so please will you all help in order to give sufficient time for an exchange between yourselves and the committee. I'd now like to call upon the scrutiny officer, Natalie Rotherham, who would like to say 1 or 2 things.
I just wanted to run through the scoping document. That's for the benefits of members of the topic group and witnesses that have joined us, and also any members of the public, so that it's very clear what this scrutiny is aiming to do, because it's got a very specific statutory remit to follow. This is a piece of scrutiny that is required of the local authority to undertake on an annual basis, and it's to look at the effectiveness of the Hertfordshire Safeguarding Adults Board, and we're looking at this specifically on this occasion during the 2020 pandemic, as it's presented a certain number of challenges. I thought it was worth drawing attention to a section within the background of the scoping document that clearly COVID-19 has presented particular challenges in protecting our most vulnerable adults in Hertfordshire, and that's also had an impact on the way that partners have worked. They've had to revise their usual working practice to ensure that those safeguarding initiatives and practices continue. I just thought that was helpful background, again, to re-emphasise the background to this scrutiny. Just looking at your 4 lines of enquiry, it's just, again, I'll just go through these. So firstly, how quickly were revised arrangements for communication and information sharing established? You've got the background report from the independent chair of the board. I think you've got a number of witnesses attending today who will be able to verify that in terms of how quickly the arrangements were put in place and how easy they were to ensure that information sharing continued to safeguard people. The second line of enquiry is how well did multi-agency working with these interim arrangements ensure safeguarding of vulnerable adults? And then following on from those 2 lines of inquiries, were there areas, or are there areas, that require further consolidation? This is partly in terms of should we find ourselves in similar circumstances, or the board is seeking to work in similar circumstances in the future, that there has been identification of the areas where further work may be required or was required in real time during the pandemic and the lockdown. And then clearly that would point to lessons learned, because I know that that is something that members have been keen across all aspects of the COVID scrutiny that they've been undertaking, is what's been learned and what could be held on to. So the anticipated impact is that Hsab, the Safeguarding Board, will be well placed to work in a sustained emergency in the future. And again, just highlighting the constraints, that you are looking at the performance of the board, not the services provided by the partners. And I think some of the witnesses may gently remind you of that fact. And I know that Liz is mindful that she wants the focus to be very much on the performance of the board and any learning that can be identified to be taken forward. And it will therefore not be looking at particular provision such as care homes. It's very much around the board to make sure that the board is doing as robust a job as possible to make sure that that safeguarding practice is as tip top as we can get it to be. So that's me finished, Chair. Back over to you.
Thank you very much, Natalie, and I apologise to everybody. I forgot to introduce myself, Councillor Ron Tyndall, and I'll introduce the other members of the panel as I call them to ask questions to save time. Now, we are just slightly ahead of time, but I think we've got everybody here. So could I invite the independent chair of the Safeguarding Adults Board, Elizabeth Handon, to give her opening presentation, please. Liz?
Thanks, Ron. Can people see the PowerPoint that's come up?
Yep.
Yep, excellent, thank you. So I'm just going to briefly go through the PowerPoint, and I just want to give you an update. So thanks for the introduction, Ron. I'm the independent chair of the Hertfordshire Safeguarding Adult Board. I just wanted to go through what the purpose of the board was, and just to remind people that the board became under a statutory footing following the Care Act in 2014, which equipped all boards in relation to identify, respond and prevent abuse. So part of the Care Act was that the Hsab and all statutory boards had an independent chair. And the purpose of that independent chair was to work with all statutory organisations, both voluntary and community groups, and the public to safeguarding adults. So part of the role of the board and myself as the chair is to gain assurance that local safeguarding arrangements are in place in relation to the Care Act, to gain assurance that safeguarding practice is person-centred and outcome-focused, to work collaboratively to prevent abuse and neglect where possible, and to ensure agencies and individuals give timely and proportionate responses where abuse or neglect has occurred. And also a main part is to gain assurance that safeguarding practice is continuous and continuously improving the wellbeing of adults in Hertfordshire. So part of my role as the board is to assure myself and gain assurance from all statutory partners and other agencies that they are safeguarding adults within Hertfordshire. So the next slide gives you the makeup of the board. So it gives you what the statutory partners are. There's 3 statutory partners for the Safeguarding Adult Board, and that is Health, Herts County Council and the police. So they're the main statutory partners. Under them become the Safeguarding Adults Board, which is made up of broader agencies and partners that work towards safeguarding and have a responsibility for safeguarding adults in Hertfordshire. We have 5 subgroups, and then we have a separate group which link into the board and look at the workings of the board. The statutory partners set the guidance for in relation to the board and what we feel is our priorities for the board. That then comes through to the Safeguarding Adult Board, and the work itself is done by the subgroups. So we have the Policy and Procedure subgroup, Joint Learning and Development subgroup, that is jointly with the Children's Board. We have the Public Engagement subgroup, the Performance subgroup, and the Safeguarding Adult Reviews subgroup. And then running alongside the board is the Strategic Quality Improvement Group, which is chaired by the Head of Adult Safeguarding for Clinical CCGs, and they report into the board as well. So the response in relation to COVID-19, as you can see on the board, is in relation to revised arrangements. Agencies put in place remote working, and part of the assurance process is for the Hsab to regulate commissioned services for partners to keep oversight of safeguarding activities. So as a result of that, we put in place statutory partners meetings, which were chaired by myself on a fortnightly basis. These were put in place as soon as COVID, so within March. Also undertaken were one-to-one weekly meetings held between myself and the Director of Adult Care Services. And the purpose of both these two meetings were to highlight any risk, harm or threats that might be identified either within the board or within statutory partners, so that we could look at how we could accommodate working with all the partner agencies. So we reviewed our business priorities for the board in relation to new pressures that were brought about by the pandemic. And that by doing that, that freed up the capacity with the board and for the additional board work that needed to take place. So some events were postponed and the rest were run virtually with core memberships only. The subgroup still continued to work, and so that the work of the board was still being prioritised, and that continued in relation to the work that came out of the statutory partners meetings that were taking place fortnightly. So we immediately developed the COVID-19 related website and web pages with resources that were from professionals and for public. And that work for the website was implemented within the first week of lockdown and was shared throughout professional networks. So work of the board and the response was that all agencies immediately put in place emergency continuity plans, and that these were shared with the board and multi-agency networks. The priorities were safeguarding the adults of Hertfordshire, and that obviously remained a priority throughout, and part of mine and the board's response was to make sure that safeguarding remained a priority throughout the other work of COVID. And as well as the communication channels that were implemented, they were received by the board around imprint safeguarding for ensuring that safeguarding work continued. The assurance that the board gained was in relation to Operation Sustain and Operation Shield, which was left by Adult Social Care and supported those who were self-isolating, and they were also supported by other joint agencies. A dedicated support line was set up for care providers with the help of Hertfordshire Care Providers Association, which offered advice and support. And in addition, colleagues from community commissioning groups were visiting care home settings and supporting with infection control. I was involved as the chair of the HSAB in the CEL project, which concerned care homes. That was initiations with the safety of people in care with learning disabilities. A group was set up supporting adults with disability through COVID, and that was set up, and I was a member of the subgroup. A dashboard was set up, which produced a weekly basis, which produced a report and recommendations into care homes within Hertfordshire. And as some members were aware, the board carried out a report in relation to recommendations in COVID and care homes throughout Hertfordshire, which was published on our website. So the lessons learnt that we carried out through COVID was the reprioritisation of the board's business, and that was looking at focusing on cuckooing, alcohol dependency and self-neglect, and giving board members response to ongoing pandemic and allow them to have the capacity to still continue with their work, but also to maintain the safeguarding of adults within Hertfordshire, which was obviously one of the board's priorities. We're learning, or we're hearing from 3 witnesses today, 3 agencies today. I believe that you have the slides that were sent through. However, I will be asking the presentations to be not to go through the slides, but to just to maintain the responses, to give a 10-minute talk and then allow for responses from the scrutiny panel to be able to ask in-depth questions on their presentation. So I'm hoping that's just given you a slight background, and I'm able to and willing to ask any questions that you might feel you'd like to ask me.
Thank you very much, Liz. Hello, I've got feedback. So can everybody else turn their mics off for the moment? Could I perhaps, before I go to the panel, ask you to explain, for the benefit of everybody who isn't aware, exactly what you mean by cuckooing, and also the category of self-neglect. I think everybody will understand the alcohol dependency category, but cuckooing and self-neglect, perhaps you could say a few words to.
Sorry, yes, of course. So cuckooing is taking this term from obviously the cuckoo bird who takes over people's nests, or sorry, other birds' nests. So cuckooing first initiated and has come through from the within Hertfordshire through the serious and violence crime strategy that the County Community Safety Unit identified, and all boards within Hertfordshire have signed up to that serious and violence strategy. And one of the strands of that strategy is in relation to cuckooing and county lines, where people from either within Hertfordshire or from other areas are coming into Hertfordshire and targeting, in relation to us, our board specifically, targeting vulnerable people who are in their homes. They are moving into the resident's home and for using it for certain reasons. So it's either being used as a home for drug dealers or financial abuse or sexual abuse. So people are moving into vulnerable people's homes to use them for their own means. So that's what the board is doing in relation to cuckooing.
Thank you very much. Yes. Right, panel, have we got anybody who'd like to ask any questions? Jonathan, would you like to start?
Thank you very much, Ron, and thank you, Liz, for giving us the picture of what's happening at the moment. Can I just ask a couple of things? One is the reprioritisation that we were just referring to, the cuckooing, alcohol dependency and self-neglect. Was that reprioritised because of lockdown, or were you considering dwelling on those 3 issues anyway this year?
They were already highlighted as our priorities for the forthcoming year. Self-neglect has been our priority for the last few years, and that's as a result of safeguarding adult reviews that have taken place over the last few years, where we've identified as self-neglect is a priority for the board and other agencies. So halfway through and towards the recovery plans surrounding the pandemic, we looked at our business plan and we looked at what we needed prioritised for the forthcoming year to make sure that our plan was streamlined so that we were still able to achieve throughout the pandemic and for the next year, but slimline. So they're the 3 areas that we highlighted as a priority for the board for the forthcoming year. So they were still on our business plan, but so were a lot of other things. So it's just been streamlined.
Thank you, Councillor Kay. Have you got a supplementary to that?
Yeah, well, yes, I have a little, but it's not specifically to that, but if I can just ask it in terms of Dr. Tanya Moore, the principal social worker, in her documents, she's with, of course, Adult Care and Health, referred to the Safeguarding Board as a critical friend. Was it more difficult to be a critical friend, perhaps this year, more challenging, if you like, because of the situation we found ourselves in?
I would say it was definitely more challenging. And I think one of the challenges was to make sure that, obviously, because of the pandemic, agencies have got a lot of different responsibilities and priorities. And I think my greatest responsibility as the chair is to make sure that safeguarding of vulnerable adults within Hertfordshire was still a priority for other agencies. So it was for me, and some of the things that I put in place, as we've already mentioned, was to actually make sure that I made sure that other agencies still prioritised safeguarding of adults. So it was definitely a challenge. But what I would say is actually that the agencies and the professionals were very willing for that challenge and willing for that scrutiny, hence the fortnightly meetings that took place and the one-to-ones that took place. So what I also implemented, or the board, was that if there was areas of concern, instead of waiting for fortnightly meetings, I would contact the relevant agency and the lead and actually speak to them as one-to-ones to raise those concerns. And at no time did I have any cause for concern about other agencies and their willingness to work with myself and the board.
Thank you, Liz. Thank you, Chair.
Thank you. Thank you. Liz, if I may follow that in, because it follows on quite neatly. Thank you for letting us know about the, you mentioned in March 2020, you had the revised arrangements for communication and information, but there's no information on the dates when the fortnightly strategy partners meeting started, and when the protocols were established that actually governed those. Have you, a rough date will do.
That would be exactly the same time. So I think so we went into lockdown the 23rd of March, or around that time, and we'd already seen what was happening and what was coming in. So our fortnightly meetings would have started even before that. And that was put in place. Originally it started and we were meeting for an hour every fortnight, and then we moved it to half an hour, and then when lockdown finished, we had the board, and the fortnightly meetings were suspended. And then as soon as we went back into the second wave, the fortnightly meetings were resurrected, and they're still continuing.
Thank you. And finally, for me, for this section, can you say, and you may want to say just a yes or a no, and then provide the details at a later date, that were there any instances that any of the strategic partners were slightly delayed or had problems in stepping up to join the organisation that you developed, or was everybody on board from an early date?
Everybody was thoroughly on board. I've had absolutely no issues with any agencies joining the fortnightly meetings, and also, as I said, if there was anything that I wanted to delve into deeper, I would contact them and have meetings, and I had absolutely no problems with that whatsoever. And all partner agencies were literally, whenever I was after additional questions, I felt very supported as the board chair.
Thank you very much. Could Councillor Dreda Gordon, perhaps you'd like to come in now?
Yes, thank you very much, Chair. I just wanted to ask Elizabeth a question in regards to cuckooing, which I also am a district councillor, so I've dealt with quite a few incidents of this over the years, and I wondered what sort of cooperation that you get from district councils where this may be happening to perhaps their tenants, and how successful do you think that any partnership with them has been in counteracting cuckooing?
I think the work we're doing as a board has highlighted that we don't know everything we should know about cuckooing. And I think one of the reasons is that different people consider cuckooing different things. So our main priority, which we identified probably about 2 months ago, was actually we needed to do a scoping exercise through Hertfordshire to find out exactly what agencies and districts felt the impact of cuckooing was on their districts. And the County Community Safety Partnership has carried out a lot of research, and we had a forum, a training forum this last week, which was attended by over 50 agencies and 50 practitioners to pull out exactly what their thoughts of cuckooing were. We have a second forum in January, and we've set up a small subgroup where we are looking at pulling together all the findings from all the districts, from all the agencies, so we can then pull together multi-agency work. And that's the point of this, us looking at cuckooing, is to say, what problem have we got in Hertfordshire? Let's have a recognised definition of Hertfordshire of what cuckooing is, which has been agreed by the County Community Safety Unit, and then look at doing some practice guidance multi-agency wise in relation to supporting cuckooing. And we've actually had one of the districts has done a lot of work on cuckooing and gave a presentation at the forum. And we have just signed off an agreement to start a safeguarding adult review in relation to a young man who was subject to cuckooing in one of the districts, and the learning is going to come out of that. But I know agencies, and I know specifically the police have spent a lot of time and have done a lot of work in relation to cuckooing, and we're working closely with them in relation to the data that they've managed to gain for us on cuckooing.
Thank you, Liz. Have you got a follow-up, Dreda?
Only to say I'm very encouraged by what Liz has told us, and I do understand that it can be quite challenging sometimes to identify these situations, because quite often, in my experience, it has been family members that are actually cuckooing.
Thanks for that. Can I just ask a follow-up on that subject, Liz? Did you find any difference in the responses from the 10 district councils between those that had their own housing units and those that actually had other arrangements for housing tenants?
I don't think we're quite there yet, Ron, for me to be able to answer that, because we're still in the process of actually speaking to all districts. So I can't say some districts were better than others. However, I can say that those that do have their housing stock obviously work differently than those that don't. And I think that is one of the big challenges that that we will have to look at when we go forward in relation to the training and support that we can give in surrounding cuckooing. Because as the board, our priority is obviously around the vulnerable adult that's being cuckooed. And that's where we're trying to pull together the response, multi-agency response, about how we can support that vulnerable victim. So I probably can't fully answer your question yet, because we're still in that sort of information gaining process.
Could I perhaps ask you, Liz, to keep that question in mind, because I think it's extremely relevant that the different types of housing provider methodology could actually affect how this type of activity is dealt with, as with homelessness and other issues. So,
absolutely.
okay.
Happy to keep you updated, Ron, on that one as and when.
Thank you very much. Have we got any other questions from any of the panel members, please? No. Well, I'm going to step in then. What can
I think Dee Hart put her.
I can't see Dee. I've lost Dee. Dee, would you, Councillor Hart, would you like to come in?
Thank you, Ron. Liz, just
Sorry
a quick question. That's fine, Ron. You've given 3 priorities: cuckooing, self-neglect, etc. How do we communicate with members of the public to report these issues regarding safeguarding? And can we improve that communication links at all?
I think we can always improve. We have a part of the subgroup is a public engagement group, and we have a learning and development or training subgroup. So what happens is the priorities are identified, obviously the strategic priorities identified by the statutory partners. They go down to the main board, and the work from the main board is then filtered down through to the subgroups. So the policy, so what will happen in relation to this is that, say if we talk about cuckooing, that will go to the policy and procedure group to look at and develop through their processes. That will be multi-agency. That will then go to the training subgroup for them to look at how are we going to train multi-agency people in relation to the policies and procedures for cuckooing. And we will also engage the public engagement group, where we will look at how can we get the information that we want to get out to the public, what is the best ways we can do that. So we've done lots of things in the past. We've recently carried out an advertisement on buses, where the screens on the buses, we were advertising on there. We do advertisements in doctors' surgeries. So we're always constantly looking at other ways and different varied ways that we can publish and get out the board's work through to members of the public. And we've recently just had someone from a carer join our public engagement subgroup, so that we can get additional support from carers within Hertfordshire to try and guide us on different ways of how we should look at different priorities. So that's really how we can do it.
Okay,
Thank you very much.
Thank you.
Have you got a follow-up, Dee?
No, I haven't, Ron. Thank you.
Fine. I apologise. Yeah, I should have to keep an eye on that. If anybody, thank you, Jonathan. Anybody else can pop up if I miss somebody, because we've only got 9 pictures at any one time on the screen. Right. Just on that subject, Elizabeth, if I could come back, you mentioned quite an impressive structure that sits behind you as the chair. Does the fact that it is quite a comprehensive structure actually delay the process at any time if there's something urgent crops up, or is there a way of fast tracking something through the system?
No, it doesn't delay it. We have our main board meetings and our statutory partner meetings 4 times a year. We have a joint board, children and adults, in March. And we also have a joint children and adults executive meeting in March. However, especially through COVID, we have fortnightly meetings. I have one-to-ones, and if there's anything that is urgent that needs dealing with, then that will come either immediately through to myself, or I will go to statutory partners and request a meeting. And we just look at what the priorities are. So, and again, if there's something that comes in, an example was there was a care home in another area, that had been closed down due to concerns, and one of the providers was also within Hertfordshire. So I wanted to speak to our HPFT to find out whether there was any issues from the Essex care home that might well have translated into Hertfordshire. So literally within the next 24 hours, we were having a meeting to discuss what their concerns were and whether there were any concerns that needed to come into Hertfordshire for us to look at. So I would say that if there's anything that's urgent, it can be dealt with sort of straight away.
Thank you very much, Liz. In the absence of any other hands raised, I've got a question perhaps on point 3, which areas require further consolidation. Did you in March 2020, you revised your structure and your methodology in response to the pandemic and the lockdown. We then had an easing off, and then we went through the summer, and then we've had a second lockdown period now. Have you found that the systems have held up, or have you had to make any subtle changes, or have you had any further learning with this second lockdown, and has there been any differences?
I think, no, I don't think there's been any differences. I think it's been, and it probably is for everybody, the second wave has been a lot easier because we were perhaps used to it. I think the first wave was difficult to get used to, not being when you're not speaking to people and you're not in the office. We cancelled the first, so we have our, like I said, our board meetings 4 times a year. Our board meeting in June we cancelled because of basically because of the other partner agencies and not wishing to pull them away from the other priorities. So I think for me the issue is that it's easy to have smaller meetings. When you do a board meeting of 30 people, it's difficult. So we looked at changing the way we did things. So when we did the main board in September, we did it with a large board, but we went into small breakout groups. So I think for us, it worked better in the second lockdown or second wave, because we'd learned our lessons from the first one about how to do things, how to streamline things and how to do things better.
Thank you, Liz. And again, I haven't got any hands up, so I'll keep going. My last question, really, it's a question of, and I realise it's about the board's performance. Have you identified the need to keep an eye on those working from home, their mental and physical well-being, and the effects of isolation could have on staff members, and so that performance, to be very honest, so performance doesn't drop off?
So part of the statutory partners meeting that we held fortnightly, that was discussed. So agencies raised whether there are any concerns in relation to sickness and welfare. Within the board itself, Mary Moroney, who's the board manager, who's on today. So Mary might be able to come in and tell you, but I know Mary was holding virtual coffee mornings, virtual tea mornings, afternoons with her staff to make sure that they didn't feel that they were being isolated. But I think Mary's probably your best person to speak on about what she put in place to make sure that the staff were looked after. Thank you, Mary. You've got about a minute or two.
Okay, no.
Councillor Howard.
Yeah, thanks, Ron. Yeah, we went to virtual team meetings. Obviously, we did things with the business unit staff, myself and Eva, who's my business manager, to support them, trying to do sort of online quizzes and fun things like that, but also, you know, making sure that we're continuing to have individual one-to-one supervisions with staff and picking up any welfare needs through that. And probably the last just thing to mention is that the board along with the Children's Partnership as well, are also offering some wellbeing training, wellbeing sessions really for multi-agency practitioners, and they're currently going out at the moment.
Thank you very much, Mary. And could everybody else take a note of how Mary was lovely and concise? Can I introduce Councillor Tina Howard? And Tina, have you your question?
While I commend everything that you've actually done, I haven't heard anything about domiciliary care. And I personally have a concern that perhaps things slip through the net, because the home carers, many of them had to be shielded at home, and people that the residents didn't know were actually going into the homes. And I wonder if there was anything that you had to consciously think about that along the lines of safeguarding vulnerable adults.
Liz?
We haven't got you, Liz.
Liz?
Sorry, adult care services are part of today's scrutiny, and I'm sure that they will be happy to talk about what they put in place in relation to that. That was part of my fortnightly meetings with the Director of Adult Care Services. We talked through any concerns or any issues in relation to care homes, domiciliary care, adults with learning disabilities, adults with physical disabilities, domestic abuse, dementia. So all the concerns that we might have had during the pandemic of groups of vulnerable people were discussed within my weekly meetings and fortnightly meetings. But the presentation from Adult Care Services might be able to go into more detail about what they actually put in place, because I know they put a lot in place.
Thank you very much. Tina, can I suggest that when the director comes on, you may want to ask him about the Providers Association and were domiciliary care adequately covered?
It was just the connection between Liz and the other groups, but thank you.
Thank you very much.
That was raised during my meetings, my weekly meetings with the Director of Adult Care Services, and then the fortnightly meetings with Statutory Partners. But if there was any issues identified, one of the things that I'm not sure I mentioned, but there was concerns in relation to adults with disabilities and attending hospital. So for when routine operations were started, and where adults were going into hospital for routine operations in relation to have to be COVID tested, I had long discussions with the director as if to how can we help and support those adults to be able to be COVID tested, isolating prior to go to hospital for routine tests. And there was also a subgroup developed from Adult Care Services in relation to adults with physical and mental disabilities, and I was a part of that subgroup, so I would go to their weekly meetings in relation to that.
Thank you very much, Liz. Right, I shall call this session to a close, and thank you very much, Liz, for your answers and the panel. And perhaps we can move on, and I'd like now to call upon the Hertfordshire Constabulary and introduce Bill Jepson, the Assistant Chief Constable, and Michael Trotman, who Detective Superintendent. Hello, Bill. Are you?
Hi, Ron. Hope you're well.
And you, and Michael, are you with us as well? Well, thanks very much. Right. I don't know if you were at the start, Bill, but we are asking everybody to limit their verbal presentation and their slides to less than 10 minutes if you can. We've all got the slides and we've read them, so that we can have a better dialogue than trying to rush it at the end. So I'll leave it to you to kick your presentation off. Thank you.
Okay, I'm just going to start with a couple of opening comments, and then Mike will take you through. There's quite a lot of detail, as you said, in the slide, so I'm just trying to capture that and then respond to questions. But of course, we've had as we all have, a challenging year, and we are learning and still learning in terms of our response through COVID. I think very much some of the questions that have already been asked, we are seeing differences between lockdown 1 and lockdown 2, and for the police through lockdown 1, very significant drop in our conventional demand, if you like, with some exceptions, one of the notable ones being domestic abuse, and that's a focus on the presentation today. What I would say in terms of our safeguarding arrangements, every single one of our safeguarding teams worked above minimum numbers throughout the whole pandemic. And what we've been able to do is flex resource because of some of the areas that we saw reduced demand. In terms of the working of the board, Liz has already taken you through, but what I'm finding is the new ways of working, the fortnightly meets, the technology has enabled us to continue to safeguard adults in the county. That's my personal view. What I see, my belief is the partnership arrangements, whether it's adults or children, are mature in Hertfordshire, and those relationships that are so important are well embedded without being too cosy. So, you know, Liz is an independent chair, and she is there to ensure that we all step up and keep it at the centre of what we do, and she does that. So just with that scene set, and I'll hand over to Mike, we'll try and keep the presentation short because you've got the detail, and then take questions. Thank you.
Thank you very much. Mike?
Yeah, good afternoon. Can you hear me?
Yes, thanks. Kick off.
I'm having a little bit of difficulty sharing the presentation at the moment.
We've got it in front. We've got it on paper at home. So if you want to kick off and keep going, you could identify your if you can't get it up, if you identify the slide you're working on, we can turn to it at home.
Okay, certainly. Yeah, for some reason it doesn't seem to be finding it when I press share. But anyway, I'm Detective Superintendent Mike Trotman. I head up the Safeguarding Command in the Constabulary. There's quite a lot of detail in these slides, so I will just sort of skip through them. The first section covers domestic abuse. So perhaps you turn to slide 3, which is the graph. Yes. Just to give you a little bit of overview of what we've seen this year. There's 4 lines on that graph. The blue line is domestic abuse crime this year. The 2 black lines show the actual period of first lockdown. The slightly darker line below is last year's domestic abuse crime. Then the orange line is domestic abuse non-crime from this year, and the yellow line similarly from last year. What we can see is that both domestic abuse crime and non-crime have been higher this year than last year. And overall, we've seen an increase of about 8.2% as it currently stands, which for the year to date, so that's 1st of April onwards, equates to about just under 700 additional crimes, in a total of about 9,000 domestic abuse crimes. And domestic abuse accounts for about 17.6% of all crime the constabulary receives. So it's a significant portion, and obviously there's lots of vulnerable adults involved in there. A slight side issue, but we've seen a greater increase of crimes where children have been involved, probably unsurprising due to lockdown, but that has provided, certainly for the Children's Partnership, a way of gaining access to children that weren't being seen through school. So a lot of work was done across all the partnerships to make sure our front line were really focusing on the children as well as the adults in these situations. So one of the big concerns for us throughout lockdown was obviously isolation. A number of vulnerable domestic abuse victims were housed with their abusers throughout this. So a lot of work was done to try and do that. Some big challenges in dealing with increased crime because, of course, we had staff shielding and staff shortages. So as Mr. Jeffson has said, we had to flex our resources quite a lot to make sure it's all been covered. I won't go into too much detail around how domestic abuse work because that's under the governance of the Domestic Abuse Partnership. But very similar to the adults boards, fortnightly emergency response groups and governance groups were all put in place very early on and maintained throughout the lockdown and even when it's completed to make sure that was all being maintained. So if we perhaps move on to slide, the one that's headed Safeguarding Adults from Abuse Demand. probably about slide number 1, 2, 3, about slide 6, I think it is. And this relates to primarily to our SAFA team that deal with the abuse against the primary vulnerable adults. Probably the highlights there are, during the first lockdown, we only had 18 new crimes reported. That compared to 41 crimes the year before, so a significant reduction. We get most of these crimes reported from care homes. They're either originated by the care home or by relatives when they do their visits. So a little bit of analysis of that really suggests that a lot of the lack of crimes coming through is where relatives weren't seeing the people in the care homes and weren't reporting things through to us. Following lockdown, we have seen a significant increase in the reporting, but of course we don't know what was missed during that period and will never come to light. But there were some big challenges with care homes, not the least actually getting our police officers into the care homes when things were reported. We had to take a pragmatic approach and obviously only go in when it was really necessary. Other technologies, video links, cameras, etc., were used to fill in where we could, and we made the best we possibly could. Also, on that slide, it talks about mental health demand. Section 136 is when someone sadly is sectioned and taken into for mental health assessment. There was a slight reduction during lockdown to we'd seen the previous year. I think it's about 8.5% reduction there. That was slightly against the national trend. Nationally, mental health assessments went up slightly. We saw a slight decrease. As the year's gone on, that trend has reversed slightly. And if you move on to the next slide, that just shows the mental health referrals, also the mental health tags that we put onto our investigation systems. There isn't a mental health crime as such for obvious reasons. If there's an investigation where mental health is involved, it gets tagged. And you'll see from that, the green line being this year, the blue line last year. To start with, it was less mental health incidents, and then more latterly, as probably would be expected, it's exceeded last year's. Data quality isn't 100% in there, and that's something that's work in progress with us. So in relation to some of your specific questions, in relation to SAFA, Liz has covered a lot of it, a lot of the meetings that were put in place early doors. Our team maintained their response throughout. It was completely unchanged. We did have to work slightly differently because we couldn't get into some of the homes, as I've already said. Social workers worked from home. There was some really good work, very early doors, between adult care services and SAFA in making sure we had the contact details so we could contact the social workers immediately. And referrals were adapted very quickly to make sure that all the relevant contact details, emails, phone numbers, etc., were on there. And within a couple of weeks, communication lines were clear and the service was normal. So that worked quite well. The Office of the Police and Crime Commissioner put some fairly quickly some online victim witness support in place that we could offer remotely out to all victims, including vulnerable victims. In relation to mental health, there was a weekly emergency mental health and COVID meeting set up. That was done in the first week of lockdown, and that was primarily around police, HPFT and the other NHS providers, particularly around some of our facilities where we take sectioned people to make sure that all worked okay. And high intensity user care plans were also shared by HPFT so that police response plans could be adapted. And throughout this process, the mental health triage service that we have in our force control room was maintained so that we had a fairly instant access to mental health systems, and our officers could seek that advice fairly quickly.
Mike, could I perhaps stop you there because I think possibly if we've got time, you can finish off the rest later.
Yeah, of course.
Could I just ask the first question? It sounds quite, the way you've coped with everything, but Bill and Mike, could I ask, how did you find that the interaction between the partners and the board and yourselves, that what the arrangements that were set up actually ran smoothly, or did you find you had to make adjustments, and is everything working okay now? I know that's a big question, but that's the main question we're here for. The interaction between partners. So I don't know, Bill, if you want to make it.
Yeah, from sorry, I forgot to take myself off mute there. From my perspective, I think the arrangements worked well because there's a degree of, I think I said, maturity within both the adults and the children's boards, is my belief. Now, some of that maturity is born out of relationships which have built up over years that you can then draw on, and perhaps, fortunately, because very often when you're building those relationships, you need the face-to-face meetings because it's the cup of coffee during breaks and so on and so forth that you build those relationships properly. We weren't in the position, obviously, to do that, but we didn't need to because, as I said, the sort of arrangements have been there for many years and the relationships have been built over that time. So you're able to draw on them very quickly. You know, I can pick up the phone to Liz if I needed to and have a very frank conversation, and the openness and honesty that comes from trust, which again you don't build overnight, was there. So we were drawn on that, not just in the adults world, but as I say, in the children's. So I think the arrangements worked well. Had everybody been new in post, question whether you'd be able to draw on that previous work in the same way.
Thank you very much. Jonathan, would you like to come in?
Yes, thank you. Just two questions, and one actually, Bill, stay online as it were, because it relates to what you were just talking about in terms of new ways of working, and I quite understand if you have people new in post and they didn't know other people, it may have been a lot more difficult. But was there anything, because you didn't have to travel from location to location, were there things actually were improved and in some ways more efficient working in this slightly newer way?
Yeah, my view, and I'll maybe pull in Mike as well. I found from my perspective, so working at the exec level, I could get far greater coverage quicker. Just because I wasn't having to move around. You know, you can bounce into meeting after meeting after meeting, and it's there. I believe what we find across the whole partnership arena is there's lots of subgroups. That's a lot of people's time sitting within subgroups. So again, just freeing up little bits of time helps us to participate more fully. So I think it's worked for some people, not all, and we've touched on in the earlier questions around health and well-being of our staff. Some people are quite happy at home. Others perhaps don't have family around them and don't have as nice living environments. So that was a draw on them. So we've got to be alive to that, and the whole welfare agenda across the partnership was really key, and we touched into it in the fortnightly meets as Liz said. So I think in some respects it's worked for us. Pros and cons, to be honest, you know. But broadly speaking, we've managed to walk through the pandemic and continue to deliver a service.
Thanks, Mike. Thanks, Bill. Mike, would you like to add anything from your perspective?
Yeah, there's just a sort of a couple of points more from the operational point of view. A lot of the practitioner meetings has been great doing them virtually, and that's something that we will carry on moving forward. Of course, with vulnerable adults, it's not necessarily so easy to do those virtually. So there were some challenges in actually getting to see people, and you know, some people, the only way you can communicate is face to face. So I think what the boss says really, some parts of it were really good and we'll maintain. Other bits were a challenge, and we just had to find ways of working around them or work around them as and when we could.
Thanks very much. Dreda, Councillor Gordon.
Oh, sorry. Can I just ask one other thing? Or
sorry, Jonathan.
Sorry, Dreda. I'm sorry to interject. It was just some clarification, really. When you refer, Michael, to domestic abuse non-crime, is that like family arguments? Is it that sort of thing?
Yes, an example would be an argument between a brother and a sister.
Right. Okay. Yeah, I just wanted to.
So just things that don't meet the criminal threshold within the National Crime Recording Standards. It's what has to be recorded.
Yeah. Thank you.
Dreda?
Yeah, thanks, Ron. Yeah, my question really is an operational one, because Bill said that obviously his teams have specialist training, and I just wondered, did the pandemic impact at all on those teams in terms of people being off sick or isolating? How would you cover any of those absences? You know, given the fact that people delivering the service have to have that specialist training.
Shall I come in, boss?
Yes, please, Mike.
I'll get used to it. I'll cover it off at a high level, and then Mike will talk specifically into the teams. So we monitored abstractions on a daily basis, and when we walked into lockdown, we were planning for 30 to 40% abstraction rates across policing, and I think those same modelling was done across the public sector. We never ever got there. So the most we got to was about 15%. And actually, as we walked through it in some cases after lockdown 1, we saw abstraction rates lower than they would be normally. There might be multiple reasons for that, but you know, officers not taking annual leave, for example, during the summer because there was no point. But the teams were monitored. We have fixed minimum numbers for all our teams, and to my knowledge, we never fell below those. And then, of course, classroom-based training in some respects fell away, but we used technology as well. And some of the safeguarding, we try to simplify, like referral mechanisms. We try to simplify things for the front line so that they didn't, you know, if there's a safeguarding concern, just tell us, and don't necessarily have to tell us which bit of the safeguarding arena is concerning to you. So just tell us. Mike, do you want to?
Yeah, I think all I'd add to that is, yes, we saw some of the lowest abstraction rates, particularly sickness, that we've ever seen during this period, which helped. We also we delayed moving some people that were due to move to other posts. We didn't make any moves during that period. We kept people where they were to maintain those skills. Yeah, we put plans in for much larger abstractions that we had and never got near them. So there were no challenges there, really. It all worked quite well.
Thanks very much. Jada, have you got any follow-up? No, right. Tina, have you got any questions?
No, thank you, Ron. I'm fine.
Okay. Right, I've got a couple, if I may, on your SAFA slide. You mentioned the crime statistics. I just wondered the types of crimes that were in care homes. Were they low-level sort of pilfering crimes, or did you find there was an increase in the more serious crime? Just generally would do. And then if you want to follow that up, is on the mental health side, where you said you saw a decrease. Could that have been part of the response towards the fact that the homeless were all housed during the lockdown, and so that therefore there perhaps was slightly less categories of mental health from that group of people, residents that we looked after? Bill, do you want to start?
I was going to look towards Mike, if I can, Chair.
Okay. Yep.
The detail on that.
Yeah, certainly. I think you've probably answered the second question there. Obviously, a lot of work was done with the homeless and taken off the streets. So I think that probably is probably the answer to that one. In relation to the first question, it's probably the more lower level crimes that didn't get reported because, for example, family members weren't going in and weren't seeing that things were missing. Certainly, the more serious incidents that we would probably expect to come in did come in. The care homes are under a duty to report those anyway, so I don't think there was any real difference in that. There wasn't an escalation in more serious reporting coming in. It was probably the more lower level that didn't come in.
Thanks very much. And can I assume that with any form of crime, does that generates a report to the board in terms of a safeguarding incident? Or do you deal with that purely as a police matter?
The matter comes in for the police to investigate. A referral would be put into adult care services for all vulnerable adults, not necessarily to the board though. Okay.
So, yeah, okay. Can I then perhaps ask Liz, if you're still there, Liz, just on that point, because this strikes to the heart of what we're here for, is on that point, would you see the need perhaps on a statistical basis that there should be some form of follow through on this sort of thing, or are you happy with the present arrangements?
Because it depends whether if there was an adult safeguarding referral, then the police will make an adult safeguarding referral through to the safeguarding team within adult care services, and that took place as it would have done during the pandemic or out of the pandemic. With the board's involvement in that, we still received all the data from the safeguarding teams. So we still monitored how many safeguarding referrals were received by the team, how many concerns, how many inquiries. And that's how we knew that obviously the level of domestic abuse and safeguarding inquiries had dropped dramatically to start with, and that then became a part of our fortnightly meetings as to, were you still happy in relation of domestic abuse incidents that you're dealing with? Is there additional work that needs to take place? Are we concerned because of the pandemic and families being locked in together, that it would be naturally assumed that domestic abuse would rise, but it hasn't? Is that because it's not being reported? So they were the things that we asked about at this fortnightly meeting. So the board was still aware of the amount of referrals and concerns that were put place into the safeguarding board. So that still took place.
Thanks very much, Liz. Given I've got no other questions from the panel, Bill, do you want to say anything in conclusion before we move on?
I think I've covered most, Chair. I think from my perspective, I see a mature partnership arrangements here and in other forums. And Liz, as an independent chair, is there to sort of hold the mirror up and challenge the organisations to make sure that we are doing what we say we'll do through our strategic planning process, and I think it works well.
Thanks very much. And Mike, have you, if you got any last minute words you want to say us, and perhaps your experience of any learning curves over the 2 lockdowns, and how perhaps you're now doing something different from where you started, and your relationship with the board.
Yeah, nothing really further to add from what the boss has just said. I think that the main thing we're taking from this is how the technology can help us. I think there's still some work to be done to embed that fully and see exactly what it looks like. Bear in mind, we've only just sort of come out of the second lockdown, but all in all, it's worked very well. 1 or 2 little teething problems along the way that were overcome very, very quickly. Other than that, nothing further to add. Thank you.
Okay, thanks very much. Right, gentlemen, thank you very much. I know you're all extremely busy, so we'll let you get away. Fine, thank you very much. We'll now move on to our next group of witnesses. We've got the CCG's National Service next, with Jane Kinniborough and Kinniborough. Sorry,
it's all right. It's all right.
Yes. Thanks very much. Tracy, I can cope with. Hello, Tracy. Nice to see you again.
So, thank you very much. So, a couple of things just to start off from me, and then Tracy, as the Associate Director, will pick up sort of more detailed discussion.
Lovely. Can I ask you very much to keep it to within 10 minutes,
yeah,
please?
We will absolutely do that.
Lovely.
So I think just in terms of the Hertfordshire Safeguarding Adults Board, probably just to flag that I'm new into the Hertfordshire system and joined only at the beginning of August. However, I would absolutely recognise and corroborate what both Bill and Liz have said. for me, it did feel like I was coming into an established system, and the level of information sharing and questioning at the fortnightly meetings and the board, I think did really support the level of trust amongst partners that you know, that when there's trust, you're able to have that open and honest conversation. So I, you know, absolutely new to the system, but actually feel very much part of the setup around the adults board. And I think, yes, I think it's sharing of information, but also sort of holding to account and understanding the risks across the system, and then what our individual responsibilities as organisations were in terms of dealing with some of those risks. Couple of things probably also to say, I think our perspective in health very much was to work with our provider organisations. We're part of the commissioning organisation, but also just to help support and remind everybody that safeguarding remained a statutory responsibility regardless of the pandemic. Within the commissioning organisations, I think we had minimal staff absences, and within the provider organisations, I know the providers are here today as well, but very close monitoring of where the risks were in the system and where there were staff absences, and actually the measures taken to mitigate those risks. Liz has described how both the Adults Board and the fortnightly executive met and continued to meet during the pandemic. But also, I think one of the questions was how quickly did we revise arrangements for communication and information sharing? And from the health perspective, since February, there was an incident control centre set up. So daily, weekly calls, and also through that group, regular cascade of communication. So as a health part of the system, we were receiving daily, hourly COVID information to cascade, and so the incident management centres had a really close eye on that and were cascading across the system. We had included in our slides, we won't go into detail if not required, but we have got colleagues here who would be able to support questions if you have them for us. So Tracy is going to focus absolutely on the safeguarding element, but we also considered vulnerable groups that we would be involved in, and again for us that was care homes and probably continuing healthcare. So that's kind of context, and I'm going to hand over now to Tracy, who will talk us through the safeguarding specific elements for health.
Thank you very much, Tracy.
Thank you, Mr. Tyndall. I'm glad to hear that you can cope with me. So I'm going to take, you've got the slides and you've obviously read them as you say, so I'm going to take you through our immediate response to some key areas where we wanted to ensure the safety of our patients, our carers and our staff. And those key areas focus around Mental Capacity Act, domestic abuse and safeguarding adults in general. So on slide 1, and I'm not going to go through each of them, but just to highlight a couple of areas, CCG training continued immediately without any gaps. We moved to virtual platforms and we also included supervision sessions, and again on a virtual platform to kind of ensure staff safety and well-being, making sure they were managing cases and not by being isolated at home, finding it overwhelming. We produced a COVID briefing, which we shared with obviously CCG colleagues and primary care staff, highlighting some key concerns around mental capacity, do not resuscitate decisions, carer stress, domestic abuse and fraud. As you know, fraud soon became quite an issue in terms of scams and other activities. Moving on then to slide 2, and that's around particularly multi-agency work. We responded to concerns about do not resuscitate, and again we sent out information including easy read to care staff primary care staff, again around reinforcing the mental capacity and the need for assessments for those people who might lack capacity. Ensuring that best interest decision meetings were taken when people lack capacity and couldn't make those decisions themselves. And this was very much in relation to swabbing, flu vaccinations, because as we know, obviously seasonal flu vaccinations have continued as well, and the issues around self-isolating and social distancing. So fairly early on, one of the key issues that we had to deal with or advise on was people with learning disabilities or maybe other issues where they didn't understand fully around social distancing and how to make that work. So again, advice and support was given around that. Moving on then to slide 3, I think we decided again that training, information raising, awareness raising continue to be important, particularly at these times, but to maybe change the focus of our training sometimes. So we work very much with our children's safeguarding team, thinking about the whole family, think family, and then produced again more training focused on issues relating to COVID. And again, we also provided that training to primary care staff. And because we'd gone on to the virtual platform, it was much easier, even in those times, to gather staff in primary care to attend those sessions. And they were well attended and participated in. One of the key things that we did, particularly around domestic abuse, is that we facilitated negotiations between transport and domestic abuse services for COVID positive domestic abuse victims to travel to refuges, because that had been highlighted as a problem as to people wanted to leave their home, but how did they get there? And they didn't always have the transport, and how did they manage? So that was something that we initiated, because a report had come in that a refuge had been forced to delay a victim's access to their service due to lack of transport. So that was soon resolved. And then I suppose the key thing for you and the scrutiny committee is around what have we learned and what do we continue to do. So I've talked about training for primary care staff, and one of the key things was around ensuring that, and it's simple things, isn't it? It's that professional curiosity, remembering to ask those key questions around feeling safe at home, about people's well-being, but also in conducting virtual consultations, which I think we all know the virtual world has changed, many things and enabled us to do activities, but it does present an area of risk in terms of you don't always know who is in the room when you're undertaking a consultation. So it's that awareness about the conversation you might be having and who might be in that room but that you can't see. We've put on an awful lot of training around domestic abuse with an expert that we've employed. And again, it's continuing work that we already had in place pre-COVID, but it's ensuring, because domestic abuse has been such a key issue during this whole pandemic, that we're keeping that focus as a high priority. And we continue to provide training around mental capacity, and we provided information and guidance around, just this week, mental capacity and the provision of COVID vaccination. I think that's all I wanted to say, and I'm going to pass on to another colleague to talk about care homes. Am I right, Jane?
Thanks, Tracy.
Thank you. Yeah, just give you some very brief headlines around care homes and continuing healthcare. So I'm going to hand over to Claire and Joan.
Hi, so I'm just going to briefly update you around the care home support around monitoring of the care homes that was undertaken during the COVID pandemic. So initially in March, obviously with lockdown, we were unable to visit the care homes. So this posed us with a problem around looking at safeguarding of the residents, quality and safety in homes. So we revised with County Council this process for monitoring, undertook weekly phone calls initially, and then moved into a virtual platform of monitoring in July, with a focus on high-risk homes to ensure that care was delivered safe and was effective. So they were the initial changes to the monitoring. In terms of the safety improvement policy, which is held under the HSAB board, this was revised and reviewed to ensure that clear escalations and responsibilities were clear, and that we had a clear process in place to escalate any concerns to maintain safety for the residents. And this was particularly an addendum to the policy was amended due to fit in with the outbreak cells that had been put in place to support care homes, which Joan will go on to talk about briefly in a moment. The other thing that has been briefly touched on is around the clinical leadership that the CCGs were able to provide to the care homes around IPC, infection prevention and control, donning and doffing in particular, because this is an area that care home staff would not be familiar with, and it was vital that they were trained to ensure the safety of the staff and the residency and to help reduce the transmission of COVID throughout the homes. So I think that's all I've got to say on slide 6. So I'm going to hand over to Joan Plant.
Thanks very much.
Okay, good afternoon. Okay, so care home outbreak management came together very collaboratively, and as you said, Ron, we learned an awful lot from the first outbreak. So the cells were pulled together in both sides of the county, and with members from public health, health protection team, who all came together, and we reviewed all the outbreaks within every single care home and supported living, including learning disability. And we offered additional support to all these places. Obviously, the cell is also looking at preventing admissions, because we didn't want patients and residents to be having to go into hospital unless absolutely vital. And we linked with all the other operational hubs. So, for example, the PPE, giving personal protective equipment out from the Hcpa, and we linked in with all that. So I think the big one here is the lessons learnt, and the lessons learnt from the care home and the cells is very much about a timely response. We really had to get our act together very quickly when COVID hit. Clear communication. We have really joined up now collaboratively with the council, with public health, with East of England Ambulance Service. We have really joined up our communication. We've obviously had to balance it with the safety of the residents. We have got concerns, and as Claire said, there are concerns with residents who've had to isolate a lot within these care homes, and we've always had to balance that need and carefully consider our decisions. And we've had to make sure that we've followed these robust processes and that we have been fair to everybody. The big one there being obviously about visitors. There's been a lot of press in the press about visitors not being allowed in and the impact for them and for the residents. So all this has been put in place in the cells, in the fact we have now an appeal process, and we have reacted to need as it's arisen. So we have learned an awful lot, and the communication and collaborative working has really now developed.
Thank you very much, Joan, and thank you, the team. Could I just clarify? A lot of the care homes are private, are in the private sector. Have you experienced any difference between their cooperation and the cooperation of the public sector?
On the whole, no. The private sector care homes have been very keen to protect their residents, to protect their staff. They, at the beginning, there was the challenge about taking residents back with COVID positive. Now there are no residents who go back to care homes who are COVID positive. They have to do their isolation elsewhere, which for some is very traumatic because we might have to move them twice. But again, this was the providers saying that they were very conscious about the safety of their staff. You know, we have had the loss of staff in some of the care homes, and we know we've had, and in the first wave, yes, we had quite a few deaths in care homes, and we have managed that now going forward.
Thank you very much. Before I bring Councillor Hart in, could I just raise on your third slide, you mentioned about care homes and the CQC, which is the state oversee quality control body, trains the existing multi-agency quality assurance and support process. That obviously existed prior to the pandemic. Did you have to make any changes to that support process in reaction to the lockdown? Because the CQC weren't carrying out inspections for some time, were they? So did you make any adjustments?
So would you like me to start this off?
Yeah.
So Ron, what was in place beforehand was and is still in place, I should add, is the Strategic Quality Improvement Group, which is a professionally aligned group to the Safeguarding Adult Board, and in fact, Liz sits on that group. It's a multi-agency group made up of CQC, police, local authority, CCGs, etc., and it is chaired by myself. So part of that, and it's been in place now, gosh, it must be 3-4 years. And one of the focuses is around a system wide approach to managing any quality issues within both care home providers and home care providers, whether it be supported living or people delivering care in people's homes. And that's been in place, and it's brought together joint guidance, joint decision making around care home and home care agencies that may be falling or experiencing some difficulties. Another member of the group is the Hcpa, Hcpa. And together we come and look at who's best placed to support those organisations where difficulties might be being experienced. And it supports the safety and improvement process, which is the board's policy in terms of safeguarding within organisations. It meets 6 weekly, and not in normal circumstances. It would meet and make those decisions. I wasn't around at the beginning of lockdown, so I'm hoping my other colleagues might step in. But I know that an addendum was added to the safety and improvement process to address COVID-related issues so that the response was timely and took into account the outbreak cells that were in place, chaired by colleagues on this call, this meeting.
That'll be fine, Tracy, because we're really looking at the interaction between partners, that rather than what each partner does. This is the main aim. So your answer's fine in basically the fact that the CQC were not carrying out inspections. Your system actually stepped up and did the job, so that's fine. Dee, you've got a question.
Yes, thank you, Ron. I've got a two-part question. So the first part is regarding domestic abuse. How has it impacted on patients within Hertfordshire who haven't been able to get a face-to-face appointment with a GP at this time?
I'm not sure, Jane. I don't know if anyone else can answer that. I wouldn't have in-depth knowledge around individual domestic abuse cases. So I'm not sure I can answer.
Can I suggest, Dee, that perhaps we take that away, and perhaps Natalie can make a note of it, and we can ask the primary care network that question, and we may want to ask the question again when the Health Scrutiny Committee comes up. I think it's a very good question, but I'm not sure it's for this body. But certainly I think we should take a note of it, because I must admit, I'd like to find out the answer myself. Being my involvement with domestic abuse, I'd like to find out the answer as well. So thanks for that. Have you got any other questions?
I have a question, Ron, if I may.
Yep.
Institutional abuse, i.e. care homes, hospital settings, etc., etc. Regarding old or elderly patients in care homes, did the CCG or a partnership membership agency actually interact with their maybe their relatives, their family members, to make sure if there was any concerns, or if they were, could you address them?
So just as a point of accuracy, we would call it, under the Care Act, it's called organisational abuse rather than institutional, just because it's around any organisation that might deliver care in a person's home or etc., just not about a building. So that's just as a point of accuracy, Dee. In terms of your question, again, I'm looking at colleagues to see who worked with care homes around relatives. I think Aaron has come in, so.
Yes, just to answer your question, Dee, in terms of the interim monitoring that we've put in place, we do seek relatives' information and intel. We also put out additional safeguarding posters, complaints posters, and care concerns advice that they could signpost themselves to us for that intelligence. We also asked healthcare professionals that were visiting the care homes if they saw relatives and residents to ask how things were in the home, had things changed, were there any concerns. And we also spoke to primary care practitioners and made sure that GPs were cited on any changes in the homes that they felt were unusual or very different, to flag to us that we could put out some more preliminary investigations to support the home. Does that answer your question?
Yes.
Could I just, before I bring Steve back, can I ask a qualifying question on that? When you say it was an independent system, what is the interaction between that system and the safeguarding board?
In terms of the monitoring? Yeah. So the monitoring would rate the homes along with CQC in similar terms, so good, requires improvement, and then it would fall into either SQUIG, which Tracy's talked about, or the safety improvement process if the concerns met the thresholds for us to sit as a multidisciplinary team to review the risk to the residents. So okay. It links in via the Safeguarding Adults Board.
Thanks so much. Dee, do you want to come back?
Yes, please, if I may, Ron, thank you. Is there a set amount of times that a GP would actually visit a care home? I.e., would they go in once a week, once a fortnight, once a month?
So most of the GPs are aligned with our care homes across Hertfordshire, so they have one point of call, so one GP, and those GPs would undertake at least one ward round a week. And on top of that, they would see any residents that became unwell and required an ad hoc visit. Many of the visits were changed to virtual to prevent transmission of COVID. However, where the need was, they would go in and visit the residents, or they would ask other healthcare professionals that were visiting to provide intelligence back to them.
Okay.
Thanks very much.
Sorry, can I just ask a quick question, Ron, if I may? Would that be from an actual GP practice, or would they be using Hert's urgent care services?
So they have an aligned GP practice that would do their normal Monday to Friday services, and out of hours they would contact urgent care or HUC.
Lovely, thank you.
Thank you, Dee. Tina, Councillor Howard, would you like to come in now?
You're on mute.
Right, yeah, no, you've muted again. Right, no.
That's it, let's try that. Sorry about that, folks. I was interested to hear about the GPs, because my understanding was that there weren't GPs affiliated to the care homes prior to this pandemic, and that now that is there. And I wonder how much the clinical leadership that you've mentioned, how closely the GPs worked with that, because was that actually put into place early enough, the clinical leadership part of things? Would you agree?
If I come in here, all the care homes did have an aligned GP. I think the change that happened during COVID was the fact that the GP practices went into the primary care networks, the PCNs. So they did all have a GP. I think what you'll find is some of the care homes did have more than one GP due to the size of the homes, but they all did have an aligned GP before COVID. I think it was the same in East and North, wasn't it, Claire? Yeah.
Thanks very much. I'm going to bring Dreda in next, and then you, Jonathan. Liz, can I mention I'd like to ask you a question at the end about the PCNs, but I'll move to Jonathan next. Sorry, Dreda next.
Thank you. I had a relation who died in a residential care home during the pandemic, and the case is subsequently under investigation. So I don't really want to go obviously into the detail. Part of the deed was this particular care home, there was problems with staffing, in as much as that there was people in isolation or out of the working environment because of COVID, and therefore some operations, and I mean things like lifting, etc., were being performed by one member of staff instead of two. Now, obviously, I'm not asking you to comment on the specifics, but I wonder if this was a trend within the complaints that you have received about care in care homes during the pandemic that were caused by staffing difficulties.
Like take this.
Unmute, Joan.
Alison, go on. Yes, please. Thank you.
No, it hasn't been a common theme in complaints that we have received. And in terms of from a system structure, all of the care providers received daily telephone calls from the commissioners, so from Hertfordshire County Council. And as part of the information they would ask for, it was around staffing and the impact of any absence of staff and whether they were able to provide care safely and adequately. And there was no compromise expected. If somebody needed two people to move them comfortably, then that's what we would have expected to be in place. So in terms of complaints, no, we haven't heard of that. And the role of that call is largely around supporting. So if people have got issues with staffing, then we would, as a system, be looking for measures that we could put into support, either from the community service or indeed through Hcpa.
Can I just ask whether or not all complaints like that received would be escalated to the board, just as a matter of part of the system?
Not to the board per se, but through the systems that sit underneath the board. Yes, they would be reported via the local authority.
Okay,
sorry,
thanks.
Liz, sorry, I was just going to say as well, sorry, we would have themes going to the board on probably a quarterly basis. So if there were themes coming from complaint letters related to care homes, they would go to the board.
Via SQUIG. Yeah.
Okay, thanks very much. So basically there would not be individual complaints, but there would be trends reported. Yeah. Okay. Jonathan, I'll give you the last question, if you could be relatively quick.
Yeah, it was just something that Tracy referred to, but fairly briefly. In a way, it's a huge problem, I would imagine. That awareness of who is in the room, if you're doing a virtual chat with somebody, and if particularly if they have a domestic abuse problem, that must be a difficult problem. If they if they've got COVID, they're shielding, they're self-isolating, they can't go anywhere else, and yet the GPs might want to speak to them virtually, or social worker, or even a supportive family friend. None of them can go in and speak to them, and that must be a huge challenge. And I'm not really sure what the way is around that sort of thing.
Can we just note that, Jonathan, because it's not strictly speaking a question about the board and performance and relationship to partners. I think again, I think you're hitting on something that's interested me all of a sudden, and so, but I think we need to take that up outside, perhaps at health scrutiny or somewhere else, because it's definitely, I think, a fact we rise. Right, Liz, could I just ask you, the PCNs were mentioned, and I just wondered, they're a relatively new creation. Have we established, are they now fully embedded into the structure of safeguarding?
Sorry, PCNs?
Sorry, primary care networks.
Oh,
the groups of GPs.
Sorry, yes, yeah, they are, and they go through the board through Jane and Tracy.
Yeah.
So we have the structure that way. So yes, they're fully embedded, and they have been for a long time, really. Can I just wanted to bring a few of the comments back really to yes, the board, and just in relation to, you identified whether there are any concerns and how they were raised with the board, and when COVID first started, I went through the Strategic Quality Improvement Group in relation to whistleblowing policies and care homes within Hertfordshire, whether they had whistleblowing policies and the council's whistleblowing policy, just to make sure that they were all up to date. So that was part of the assurance that the board went out for, and I received assurance back through via SQUIG to say that whistleblowing policies were up to date and were being used. So that was one thing. And also about concerns in relation to individual care homes coming to the board. So Tracy, as she's already identified, is the chair of SQUIG, and Tracy is a board member. And as part of our confidential section in the board, Tracy provides us with an update in relation to the chairing of her subgroup, and whether there are any concerns specifically in relation to homes that need to be identified for joint work. And if there are any particular concerns, we do have presentations at the board, and there has been occasions when escalation has needed, and I've written to the managers and the directors of care homes, as my role as the independent chair, in relation to the work carried out through CCGs and adult care services, to try and encourage joined up working from the care homes themselves, to support the process that's taken place.
Thank you very much, Liz. I'm going to close the questioning there for the section, and can I thank everybody from the NHS, and nice to see you again, and nice to meet you, Jane, and hopefully see you again in pleasanter circumstances, where perhaps we're over a cup of coffee one of these days. But thank you very much, everybody. All right, we're going to take a short break now. We're only a couple of minutes over time, so we're not doing too bad. And thank you to the panel. We drifted slightly the last one, but I thought the questions were important enough to at least be aired, and we can perhaps follow them up in other channels. Right, we'll reconvene. If you'd like to leave your technology on, and perhaps just mute yourselves, and then return at 2:50. Well, 2:53. I'll let you have a full 10 minutes, and then we'll kick off. And we've got the adult care team, and then while you're having your break and while you're doing that, perhaps you could give some thought to our final job at 4 o'clock, which is to actually consider what recommendations we might want to make. So perhaps I could ask each of the panel members to give some thought to that and what you've heard already. So we'll come back at 3:53. Oh, make it 3:55 because I've waffled on. Cheers.
I think you mean 2:53.
Yes, 2:53.
Can you all see the slide that I've just put up? Those of you who are on there.
Yep, I can see the slides.
Okay. Thanks. That's amazing. It worked.
Tanya, I don't know whether you'd picked up the request from Liz and the chair, is that it's 10 minutes tops for the presentation. So don't know whether you'll just be dotting through your slides to pull out the key bits and pieces.
Excellent, promise.
Yeah, that's fantastic, because what I don't want to do is that you suddenly get you suddenly have to stop and you've not been able to cover everything, and then it'll move into member questions.
Absolutely, promise. I never speak for more than a few minutes.
Thanks, Dan. We should be starting in a couple of minutes. We're due back at 5:02.
Okay.
We're about 30 seconds to live again, so if everybody could prepare themselves. Let me know when we're on live, Natalie.
Fiona's just getting that sorted out with IT.
I can confirm that you're live now.
Thank you. Hello, welcome back to this topic group and scrutiny of the Safeguarding Board processes. And I'm pleased to say we are keeping reasonably well to time. Our next presentation is slightly longer. It will last for an hour. It's various activities within adult care services. So what I'd like to do is initially introduce the Director of Adult Care Services, who will then introduce his team and how they propose to deal with the hour. And could I ask that presentations are kept to the minimum and sufficient time is left for asking for the panel to ask questions. So is Chris Badger available?
Ron, sorry, it's Mark Harvey here. Chris unfortunately can't join us today, so Tanya and I will be leading on.
No problem, Mark. So if you'd like to introduce the session, and then I'll leave you to conduct the way through. But if I interrupt you, perhaps if I feel it's appropriate to ask questions at any point, and then we'll do that. But I'll leave it to you, Mark, to conduct the process.
Brilliant. Thank you so much. So just as a very brief introduction, obviously my name is Mark Harvey. I'm Operations Director for Adult Care Services, and today we've got Dr. Tanya Moore with us, who's the Principal Social Worker for the County Council, and as by virtue of being the Principal Social Worker has some statutory and regulatory responsibilities for adult safeguarding on behalf of the Council, and acts as the key link between our board and Chris as Director and the day-to-day practice and responding to adult safeguarding as it's been set out in the Care Act. We've been asked to provide a few slides to give an overview. So we've got some brief slides on all of the key areas and more importantly, how they interact with the Safeguarding Adults Board. And very much so Liz's involvement. A lot of it will re-outline some of the narrative that Liz gave at the start, but we can add some of the detail to that. So Tanya is going to take us through the slides. We had penciled in for about 20 minutes to go through the slides max to allow as much conversation as is possible, either through the slides or at the end for Q&A. So do feel free to stop us if needs be. And I'm going to hand over to Tanya, who will take us through the slides, and I'll chip in every now and then.
Thanks, Mark. And
Tanya.
Sorry, I'm just diving in there as I always do. I'm so sorry. I mean, I've been tipped off 10 minutes, so I'll aim for 10 minutes. Let's see how I do. I promise 10. Timing myself now. So I just want to start off by really agreeing with all that's already been said by other colleagues on the call about the established clear lines of communication that we have out in practice with Hearts Safeguarding Adults Board, and the clear accountability and the clear collaboration. So all of the activity that I'm going to highlight, it's all with a view to the connection that it's had with Hsab, Hearts Safeguarding Adults Board. So everything I'm going to talk about has been planned or executed with some level of oversight or collaboration with Safeguarding Adults Board. So the first slide is a very quick overview of our care home cell response, which established very quickly at the end of March. And this was our way of coordinating the response of multi-health and care home agencies, and it consisted of a strategic coordinating cell and then locally clinically led cells. And it's been referred to already. Its function was to understand all of the information that was available to us and get a real grip of the scale of the issues that we were facing, and also to create individual action plans to work with to mitigate those impacts and to offer guidance on visiting and pause to admissions, any other way we could support the care homes. But it was also, very importantly, about sharing learning and best practice, and it was also a formal forum in which we could escalate issues. So issues around testing, gaps in guidance, accessibility to resources. And we worked with Safeguarding Adults Board to add this as an addendum into the safeguarding processes across Hertfordshire, so that these COVID cells could feed automatically into the whole of the safeguarding process. And obviously, I've just put a note here that one of the main things we were talking about was PPE in the early days, access to PPE, but all COVID-related safeguarding concerns are now being brought to the outbreak cell for actions and for key themes to be identified. So this system has underpinned pretty much everything we've done around COVID in Hertfordshire. We've already had mention of the state of the market spreadsheet that comes out daily, in fact, combining information on each care home, supported living and home care service in Hertfordshire. And this tells us where there are positive COVID cases in Hertfordshire, including staff. It tells us about the key trends on COVID positive cases, and it also talks about PPE or staffing concerns that might be going on at the moment. And this is shared with the safeguarding team and with the operational staff within HCC, as well as health partners and public health. The provider hub, this was set up on the 12th of March. Liz did say that we kind of spotted what was coming before lockdown, so we set this up very quickly. And this is ACS in collaboration with Hearts Care Providers Association and supported by the CQC, the Care Quality Commission. And it's a 7-day telephone helpline, it's email support, and it's FAQs for care providers. And again, its function is to share intelligence. That's been so important as information has been changing. Sometimes not even on a daily basis, sometimes several times a day, the information we have has been changing. It's been cascading latest government and public health information, and it's been supporting with issues and concerns that have arisen. And the support has been around, again, access to PPE. Some of you will have been aware of the huge issue we had in getting hold of PPE at the beginning of this, understanding the requirements, sourcing it, organising urgent deliveries from the local resilience forum. Also around staffing capacity issues, being aware of the impact of sickness amongst staff, self-isolation in the early days, and being ready to respond to that. Infection prevention and control training, training around the correct use of PPE, staff support and training, access to clinical supplies, accessing food. You'll remember in the early days we had an issue about accessing food and cleaning. It was a huge piece of work for us. Hsab were fully involved with this, and it was acknowledged nationally as an exemplar for support to the care sector. Liz has mentioned that at the very early stages of the first outbreak, it was clear that there was a national focus on older people, but little acknowledgement of the impact on people with a learning disability. So in response to this, Hsab and the Adult Disability Service work collaboratively to develop governance and practice oversight arrangements to understand and respond to the impact of COVID on this particular group. So this work included tailored guidance to providers of learning disability services, monitoring of infection and mortality rates within this group, prevention activity and training, targeted communications, care need oversight, and Hsab were present on the governance group for all of these issues. The Acs Safeguarding Service, interestingly, our data from the very start of the pandemic showed a significant drop in referrals. I don't know that we anticipated this, but this is what we got. So we worked with Hsab and ACS to produce information that could be shared on the Hsab webpage about keeping safe under lockdown, how to raise referrals, issues relating to domestic abuse, and how to report concerns you have about other people or about yourself. Liz and Hsab asked us very early on for specific information about domestic abuse referral rates. They wanted to, watch the way the rates were going, and they reported. Oh yes, it was Hsab who reported the change in policy on low-level medication errors and distributed a flyer to alert to the change. So what that's about is we changed the way that we record low-level medication errors, and it was a way that we could respond to the different demands of the service at the beginning of COVID. And Hsab picked up on the issue of blanket applications of do not attempt resuscitation agreements in care homes. This was a really, really worrying and dangerous idea that was kind of pervading through the care homes at the time. It was Hsab picked up on this very early on, and ACS Safeguarding provided information and worked with the CCG to produce guidance notes for GPs to be really clear that there are no blanket DNAR agreements put out anywhere. Liz has already mentioned the Hsab review of care homes. So this was an online survey of 98 homes, looking at the key factors that impacted on the spread of the virus. I'm not going to go through this, but I am going to say that it was in conversation with the Director of Adult Care Services. Liz has mentioned she was having weekly conversations with our Director, that they were looking at making sure that the survey wasn't attacking the care homes in any way, that it was seen as a supportive survey. It's been an incredibly difficult time for care homes in Hertfordshire and around the world. And the last thing we wanted to do was be pointing the finger, but we did really need to understand what had been happening, and we needed to find out what we could learn and what recommendations we could make. And the report's done that, and the recommendations were made, and learning has been offered across the Hsab partner agencies. And I really have done well doing this quickly here, haven't I? Just a final slide here about Hsab and ACS collaboration, which is that throughout this, I don't want to say unprecedented, it's too much of a cliche, but incredibly difficult time. But all workers, I suppose we're not just workers, we're all people as well, and we've all faced our own challenges through this pandemic. Hsab has worked with us collaboratively and, as I said, as a critical friend. And it's been through a number of ways. So Liz and the Director of Adult Care Services have been meeting weekly throughout the COVID period. Liz and I have been meeting on a very regular basis. And the understanding is if I email Liz and ask for a conversation, I get that conversation. Liz has been attending all of the key Adult Care Services Senior Management Board resilience meetings where she's been needed, where there's been a safeguarding issue. There's been joint work from Hsab on the cell and hub response, providing advice. Hsab and their chair has been a core member of the Learning Disability Response Group. Hsab have been receiving and commenting on reports and recommendations that have come out of Adult Care Services, and it's a personal note from the Safeguarding Service in ACS to Liz that the open and supportive approach from the chair has been very much appreciated at a very, very difficult time. And that's me. Thank you.
You're on mute, Councillor Tyndall.
Oh, still on mute, Councillor Tyndall.
Ron, you're on mute.
Yeah, fine. Sorry about that, folks. Following my own instructions and forgot about them. Yeah, sorry, if I could just introduce, because I think it was a subject of particular concern in some families, the do not resuscitate and the blanket applications. I just wondered if Tanya, Pat, or Liz could just illustrate how the board got involved and how that was then raised with ACS and how the protocol was established and the guidance notes and what changed. Because I think this is an issue of communications, which I think goes to the heart of what we're doing today.
It absolutely does, and it was with the head of safeguarding, Keith Dodd. So I don't know, Liz, because it was you and Keith who brought up this piece of work. Do you want to talk to this?
Yes, happy to. So it came to my attention actually following one of the meetings I attended. So I attend, I think I've mentioned previously, National Chairs meeting and also Eastern Region Chairs meeting. And it was identified as a possible issue in other areas that had been picked up on as being a problem, that their care homes had received these blanket do not resuscitate forms. So I had a meeting with, as Tanya said, with Ian McBeath at that time, and he agreed to do a quick check to see whether any of our care homes had received any do not resuscitates, as it was raised as an issue, and it appears that a couple of care homes had in the eastern region, the eastern part of the county, had received blanket DNAs for do not resuscitates for their residents. I think one care home who had 75 residents received 75 do not resuscitate notices. So this was highlighted obviously as a grave cause of concern, and then exactly as Tanya said, a new piece of work took place, and it was escalated, and guidance came out very quickly that this was not to take place.
Thank you very much, team. I think that's an excellent example of the board working in action with partners. Thanks, Mark. I'll go back to you to finish off your presentation, and then I'll throw it open to the panel.
Thank you. Well, I think Tanya's covered most of the detail. I think we wanted to give you the headlights and allow opportunity for questions and discussion. I suppose the only thing really just for me to add is again that the relationship between adult care services and the board has been probably intense is a good word, in a good way, over this period, in that actually it has been very collaborative. I hope Liz, when she's felt able to challenge, be devil's advocate and be a critical friend, has been able to, but likewise I think certainly we feel that's worked both ways during this period. So that's certainly been very helpful, and I think it's allowed us to pick up on areas collectively that may not be in the forefront of our mind in what's been incredibly busy periods of time.
Thank you very much, Mark. Well, I see Dee would like to come in, so Dee, over to you.
Thank you, Ron. I appreciate that. I was just going to say, could I congratulate everyone involved in, adult care services and the Safeguarding Board, because picking up on these do not resuscitate forms, etc., I think is the correct way forward, in also giving members of the public the the confidence that we're all working together for positive outcomes. So I would just like to say thank you to all concerned. Thank you, Ron.
Okay. Would someone like to take that on? Hello?
Ron, sorry, I think I've just had some problems. So all I got was the initial part of Dee's question, which was thanking us. So if you could just rephrase, that would be very helpful.
Dee, can you follow up? Have you got any direct question?
Yes, following on from a little bit of praise there to all concerned, clearly, what are the lessons learned from this swift action that was taking place and partnership agency working?
Brilliant, thank you. Shall I start? Is that all right? Then Tanya, feel free to to come in. So I think in the first phase, the fact that it was raised very quickly allowed us to, for want of a better word, nip it in the bud across the rest of the county. So we were able to get that information out fairly quickly. I think there's been quite a lot of learning from that. I think the ability for us to work quite closely with the CCGs, the primary care networks and GPs in particular, who are quite involved in these conversations around DNA CPRs, has been quite key. It's also allowed our nurses, both in the community health trusts, but also the nurses that the county council employs, to be able to do some very tailored comms so that we can provide information and advice to individuals in care homes, but also their families, as well as to link in with GPs to make sure that we're very clear about the processes and the protocols. And I think sometimes, even where DNA CPRs are correct and they are the right thing for the person, there is something further as well, because we've certainly found on very few occasions that there are still concepts that means don't admit someone to hospital, don't take them to hospital, and that's not the same. That's absolutely not the same. And so we want to be very clear around how DNA CPRs should be applied, even where they are appropriate to be put in place, is that they're done in the right way. It's also led us to do quite a lot of work on advanced thinking and advanced planning for individuals, so that they're able to set out how they would like their health to be dealt with at the time where it may be end of life, what sort of treatments they would like, and their views on that, so that there's some direction from the individual prior to possibly either losing capacity or being too unwell to make some of those decisions themselves.
Thank you very much, Mark. Has anybody got any other questions for the team? Trader.
Thank you. I just wanted to know how well our officers think that planning and arrangements went for people being discharged out of hospital where they may have been treated for COVID, when they have a caring responsibility at home. So, you know, was there any extra provision of support to help them in the short to medium term?
Brilliant, thank you. Tanya, shall I start, or did you?
Yeah, no, please do.
So I think what we've done in those areas is that at the very start of the pandemic period, we developed what we called a very new kind of needs system, so that we could understand who had a level of needs, who we needed to be able to respond to very quickly, so that we had that information in advance of those issues arising, Councillor Gordon, so that we could react fairly quickly and set up fairly responsive care plans. Our hospital discharge teams, or what we call integrated discharge services, they've been fairly phenomenal in understanding the background. And one of the benefits we have in Hertfordshire is that when the new discharge arrangements came in, our social workers are so integral to that discharge and the joint working with the trusts, is that those are the exact sort of questions that social workers bring to discharge planning. And if they were aware that they did have carers' responsibilities, then they certainly would be able to set up additional care packages or support, or link in with the relevant community teams where they needed to pick that up going forward. So the system is absolutely there. Is it 100% perfect? I would say no. We need to get much better at having carer contingency plans logged for these eventualities in advance, so that carers can be very clear about what they need and what they want. And it may be that it's not us delivering it. It might be about us contacting wider family who would like to provide care and support. So I think we've definitely learned. I think we've got it there as one of our core discharge processes, but we've also got a new system where we are monitoring all carers so that we can be proactive if we need to.
Thank you very much, Jonathan. Dreda, have you got anything you want to come back on?
No, just to thank Mark Harvey for his very honest appraisal. Thank you.
Thanks very much. Jonathan.
Thank you, Chairman. There is reference in the 4B document about engaging regional colleagues in a joint safeguarding adults review investigating COVID-19 related deaths in care homes. How much did you use wider colleagues outside of Hertfordshire in order to engage in what you might consider to be best practice in relation to the pandemic?
Brilliant, thank you. I wonder if, Liz, I'm not sure, is that reference to the regional documents and the work that you oversaw?
Yes, I think that was partly it, Mark, and also so it was to do with the meetings that I held. Oh, sorry, my computer's gone a bit. Can you still hear me?
Yep. Yeah, we can hear you.
Sorry, I don't know what's happened there. So it was to do with the regional meetings that I attended. So as I said earlier, we attended national chair meetings, but also during the pandemic, there was regional Eastern Region chair meetings, which usually take place every quarter, but during the pandemic it took place every month. And that was to look at what problems were affecting other boards and other agencies across the whole of the Eastern Region. So some of the work that came out of that then went into the Statutory Partners meetings. So that's I think is part of that. And then part of the discussion was we did our as you know, our review of care homes, and that was fed back through to the regional chairs meeting where I presented that. I don't think any other region, but Mark might be able to say different, carried out a full review of their care homes, but I know they used the learning from our review into their own regional areas.
Thanks very much, Liz. Right, Dee, Jonathan, do you want to come back first?
No, that's fine, thank you.
Dee, have you got another question?
No, Ron, sorry.
Mark, I've got a question which I forgot to ask our NHS colleagues, but you may be able to help. I think there was a mention during their presentation of continuing healthcare, and I just wondered, it's an issue that comes up now and again. I just wondered, particularly with regard to safeguarding, whether continuing healthcare and normal care home sort of residents, perhaps you could give a quick explanation of the two for the benefit of everybody listening.
Is that in terms of what the difference is?
The differences and also particularly any differences in the way we would treat them in terms of relationships with the board.
Okay, no, absolutely. So the key difference between continuing healthcare, so individuals placed in care homes or nursing homes under continuing healthcare and those supported by the council is one predominantly of level of need and funding responsibility. So where people meet a certain eligibility criteria for ongoing continuing clinical healthcare needs, then those are generally funded by the NHS. Whereas the majority of other care home, nursing home places are funded by the local authority. I would add on to that, there is a third group, which is self-funders, of which we have a reasonable amount in Hertfordshire who self-fund and may not be on either our cases or necessarily picked up by the NHS other than general interaction. So there's three ways people are funded for care in residential care. In terms of safeguarding, so the formal statutory safeguarding responsibilities that sit under the Care Act, there is no difference in terms of response. So the local authority is accountable for everybody. So if there is a concern raised, that will come into one of the adult safeguarding teams, which Tanya oversees as part of her service area, and then they will make a decision under what we call Section 42 of the Care Act as to whether there needs to be an inquiry. An inquiry in old money is kind of an investigation, really. It's a way of engaging with everyone concerned, find out what's happening and see what we can learn and add benefit to, and if abuse is ongoing, how we can stop that happening. The key difference there for CHC and other people placed is that the inquiry officer will often be the CHC officer, whereas all the others will be local authority officers that undertake that. So that's the only really key difference between the two. In the wider sense of safeguarding, so outside of the Section 42 element, I think our health colleagues set out quite helpfully earlier the SQIG processes, the SIP processes that we have in place, and they're all done jointly with the council. And as Liz has mentioned, she takes part in all of those meetings. So we try to have a single approach, even though we've got multiple organisations involved.
Thank you very much, Mark. That makes it much more understandable for those who weren't aware of the fine detail, as it were, and the distinctions. I've got other opinions, but I'll keep those to myself for the time being. Liz, do you want to come back on any your point, from the board's perspective on that?
No, I don't think so. I just wanted, I know it's in the presentation that Tanya sent out about the medication error policy, and I didn't know whether they wanted to pick on that a bit more, because that was something that actually was really helpful for other partner agencies in relation to the amount of referrals and support required during the during COVID. So I thought that would be sort of good to have explained a little bit more.
Yes, fine. If someone would care to set off and others can join in the journey, to use the train metaphor, so beloved of one of our national medical advisors.
Brilliant. To do that, or?
Yeah, no, go ahead. I'm enjoying listening.
Okay, so I think this has been a key area that we've looked at quite a lot over recent years, and actually it's a piece of work that very much has been on the agenda for both the Safeguarding Adults Board and us as in delivering our adult safeguarding responsibilities. So you will have seen from previous years of data that we have a lot of safeguarding referrals which either come to neglect or acts of admission, and quite often when you drill down into those, the vast majority of those will be medication errors. Now, some of those absolutely we need to look into and investigate, but quite a lot of those medication errors may have been something simple like someone was given their paracetamol at 4 o'clock and not at 12 o'clock. So no actual potential risk to the individual, and not really defined as an abusive act. It was a small error that hasn't had an impact on an individual directly, and that the care homes quite often learn from that and make changes to that. Or alternatively, there might have been one missed dose of medication that again has had no detrimental effect to the individual, was picked up by the systems and has been responded to. So one of the things that we did at the outset of this, whilst trying to resolve this issue for many years, is actually to work through what is the difference between those medication errors that we do need to pick up as safeguarding concerns, and what are those that we don't need to formally put through safeguarding referral processes for inquiries and concerns, but still make note of. So that we can follow up with our commissioners in our monitoring, just to make sure there isn't trends of medication errors that go forth. So in collaboration with the board, that we developed a new policy which sets out a level of expectation about what we will record and what we won't record, and what we will and won't take through to inquiry. And the key thing for this is that it removes a lot of bureaucratic burden from our care home providers and our social care providers, as well as our social workers as well. So I'm sure you're under quite a lot of paperwork gets brought into the system, and at the time we were doing all of that paperwork for stuff that wasn't technically adult safeguarding concerns. So we've removed that from the formal processes, but we do have a very clear process to ensure that our commissioners, our CCG colleagues who do monitoring as well, are well aware of any concerns or trends that become a bit of a pattern, so that we can still act where needs be in any particular care home.
Thanks. Just to add, sorry, we were planning to do that anyway. This had been a piece of work we've been doing and working towards, but when COVID struck, with Liz's support, we were able to just make it happen very quickly.
Lovely. Are you content, Liz, that we've now got a system that covers that sort of thing?
Yeah, absolutely, and I think that's exactly what Tanya said. It was a piece of work that was being discussed for quite a long time. And actually, when the pandemic started, it was that piece of work that actually needed to be escalated to get, not escalated, but needed to be prioritised to get done quickly, because of the amount of safeguarding referrals obviously still coming in. So I think it just showed a good piece of work that we could do to bring forward something that made a real impact that came through the board. So, and it was a really good piece of work that Adult Care Services did. So that was it was appreciated.
Thanks very much, Liz. With no sign of any other questions coming up from the panel yet, I'll carry on. Mark, Tanya, can you tell me if during the course of over the last 9 months or so, you've had any pinch points that have been recognised in the systems, any difficulties which have been coming and they've been managed and resolved, and the interaction with the board has been a key process?
Shall I just pop in with a quick one, Mark, and then you can pick up more strategically? I mean, from a practice perspective, it's been those people who are at home on their own, not in contact with anybody else. So it's been domestic abuse and it's been self-neglect. It's those people. So there was a lot of thinking very early on about how can we make contact with those people, and some work done with the board to look at how we can publicise this, what message we can get out, what just how we can work together. And that for me was an example of the board and the Safeguarding Service within adult care services really putting their heads together to come up with something.
Lovely. That's I'm very keen to hear that, because earlier on I think one of the other panel members was referring to domiciliary care and concerns. But Liz, do you want to add anything to that?
No, I think it's you've had quite a few examples today, and I think it's like Tanya said, there was it was issues at the very beginning that were discussed and brought out through the statutory partners really, and I think they were to do with the dip in safeguarding referrals. How could we make sure that even though the dip was there, was the work still taking place in relation to safeguarding? So for me, it was the board's job to make sure that agencies were still safeguarding and still prioritising safeguarding, even though the dip in referrals was there. And it was also, I suppose, it was highlighting things that because adult social care weren't going out to do visits because they couldn't, were they still happy with the support and care that they were given? So that was some of the other things that we were looking at. I think I've already mentioned again, it was domestic abuse. We were concerned about the drop in domestic abuse, where we felt that actually it should have increased. So what could we as a board do together with our partners to make sure that actually people could report domestic abuse? And I know there was a lot of work and publication about even if you're in there and you can't get away from your abuser, there are other ways of reporting domestic abuse. So there was quite a lot of work that we did, and that came out of the Statutory Partners fortnightly meeting. So it was, what do we think the problems are, and how can we as statutory partners make sure that those problems are dealt with? So for me, that was the biggest priority through this pandemic, was to look at look into the future, really, to think, what do we think those problems are? So I know that's something that literally was raised at my last one-to-one with the Director of Adult Care Services in relation to the level of referrals coming in through domestic abuse, or not so much domestic abuse, for safeguarding referrals coming in where taking place at a person, within a person's home. So that now is quite high. So I wanted to delve down into, so if they were taking place in a person's home, is that because the abuser is a carer or a family member? And is that because there's a thing as in, so if it's adult with learning disabilities or physical disabilities, they haven't been able to go to respite, they haven't been able to go to their clubs. Has that caused stress within that household, which has then resulted in domestic abuse taking place because of they're not being given the support? So that was discussed with the director, and he's come back to say, well, actually these clubs are open, respite's open, they're funding additional respite. So they're the sort of things that came out in relation to the statutory partners and my one-to-ones with the Director of Adult Care Services.
Please, can I just add a point to that? Yep. Councillor, is that all right? Just that it's an example of Hsab being a critical friend to the Safeguarding Service and Adult Care Services. So right at the start, we've said a couple of times, domestic abuse referrals and self-neglect referrals went down. And it was Liz as chair saying, but I need to understand why they've gone down, what's happening, where are those people, what's happening? And that caused the Safeguarding Service to compile a list of all those people who had been referred to us for domestic abuse or self-neglect over the previous 12 months and take that list out into the teams and ask the teams to make proactive contact with those people. And I think that was, we may have got there, but we got there very quickly because Hsab asked the right questions.
Thanks very much. And now I'm going to ask Mark and Liz a question. I'll let you off this one, Tanya, because I think, well, you can join in if you want. It's more or less impossible to answer, but we seem to have a reasonably, I'm trying hard not to praise you too much because we're supposed to be scrutinising you, but we seem to have a reasonably well performing safeguarding system in Hertfordshire, and I just wonder if we hadn't had such a system in place, how much delay, how much additional problems would it have thrown up to have actually have to create it from scratch with the onset of the pandemic? Now, as I say, it's probably an impossible question to answer, but I just wondered if either of you would have a stab at it.
Do you want to start, Mark?
I'll go on. I'll start. Nothing like an impossible question, Councillor. Yeah. So I think it's hard to know what you don't know, but I think fundamentally what has enabled us to deliver what we have delivered, and there's always room for improvement, so I don't want to say there isn't, but I think it's very much about the level of relationship work and organisational joined-upness, for want of a real word, that takes place in Hertfordshire. So there are very close relationships between the Safeguarding Board and Liz as the chair with the County Council. Obviously, we have a statutory duty about adult safeguarding, but on top of that, those relationships extend out into the CCGs and health partners and the police, as you say, and many other organisations. So I think the ability to have very quick, open, frank if needed, but also supportive conversations is there already. I think if we hadn't had that, standing that up very quickly would have been much trickier, because we wouldn't have understood each other. So I think the ability, the relationships and the nature of the board we have has certainly enabled us to do that fairly quickly.
Well, I think that's first class. You've given us at least a sentence or two for our report. Liz, do you want to add to anything on that?
No, I agree with Mark, but I'd like to raise as well, really, that Jane has, from CCG, as she mentioned in the opening, that she hasn't been in Hertfordshire for very long. So Jane had to get used to the Hertfordshire ways very quickly. And that could have been very difficult to start with on both sides, really. It could have been difficult from the board and it could have been difficult from her side. And I think a lot of it, you have to be careful for people coming into Hertfordshire, for us to say this is the Hertfordshire way and look at us, aren't we fantastic? Because people coming in, you can't obviously, they have perhaps different views. So I think for me, part of the board is that we have a pack that goes out to people that join the board. So it's a sort of a book, really, of who is the board members, what the board is all about, but also what the board expects from their board members. So she had an idea about what we expected from her. I expected from her as the chair of the board, but I also held a one-to-one with her literally within, I think it was about the first week of her being here, and then a month later, just to try and make sure that if they're and to build those relationships, but also to try and make sure that she knew that this is where she needed to go if she had a problem or if she had a concern, or she needed, more importantly, needed to escalate or raise any concerns either with the board or with other agencies. So I think that helped as well. And I think Mark's right. I think you have to be really careful to make sure that, because the agencies and partners have got a good working relationship, part of my role, I think, is to make sure that we don't get, and I think someone else mentioned it, we don't get too cosy, because that can be disastrous. So as far as I'm concerned, that part of my role is to make sure that we do the same as you do. So we scrutinise the response. So if I call a partner to present at the board, I will expect the other partners to scrutinise their presentation and their response. I won't expect the other partners to just sit there and accept everything that they've said. And I think that still works within the board.
Thank you, Liz. I can appreciate the problem of becoming too cosy, because I think that also applies to councillors and officers. And it's a fine line that we all have to judge, because on the one hand, we like to have a reasonable relationship. On the other hand, we have to ask the tricky questions. And so I think, I think the Hertfordshire generally has got a good atmosphere for that sort of thing. Jonathan, you wanted to come in.
Yeah, it slightly follows on from that in terms of we all saw the lockdown very much as the sort of work the Hertfordshire Safeguarding Board is doing as very much a challenge. But I'm wondering if there are any pandemic-induced systems, be they administrative or virtual, Zoom, Teams, that sort of thing, that actually improve the outcome. And maybe you think, well, this works better than it would have done a year or two ago, not using the systems we're using this year.
I think there's quite a lot. So I couldn't have had weekly one-to-ones with board members or with the Director of Adult Social Care, because it doesn't just happen for half an hour. I mean, in the end, we were doing half-an-hour calls. We started off for an hour. So to do it over MS Teams worked absolutely brilliantly. So those sort of things, and the fortnightly scrutiny, I think we didn't have a time when agencies weren't represented. We had agencies, and if there was anything specific, then I could invite other agencies. So one part of the scrutiny, I wish to discuss a certain private hospital within one of the areas. So I invited a different agency to come because it had an impact on all the other agencies under scrutiny, under the Statutory Partners. So I think that made it work a lot easier, and because it's easy to be able to fit half an hour in your calendar when you don't have to drive an extra hour and then find somewhere to park. And so that side of it has worked really, really well, and I think will continue to work. We've been able to, the board has offered a lot of training virtually. So we've been able to safeguarding training. So we've still continued with our training online, and that has we've had so many more people attend because of that. And we've been able to do morning sessions and afternoon sessions. So we've been able to double the amount of attendance that we've got. And also that impacts on cost as well to us, because we then don't have to hire the room. So that's impacted on the cost. And of course, I don't have to buy tea and biscuits for everybody. So that impacts on the cost as well. So it's for that, the benefit has been really good. The downsides are in larger meetings, it's harder to get people that don't perhaps want to talk. So if you're in a big, where we have our board meeting, there can be 25 people attending. And if I'm sat there and I look round the board meeting and I can see people who haven't contributed, I can always bring them in and make them contribute, obviously if they've got something to say, but try and get them to contribute. It's very difficult to do that on Teams because you can't see everybody. So there's pros and cons, but I think one of the highlighted things for me is how quickly policies and priorities have developed, where I think where before they would take a lot longer, as in medication errors, you can develop them a lot quicker because people have joint priorities and they come together as a priority, and that has really helped. So that was quite long-winded. Sorry, Jonathan.
No, that's good.
That's brilliant. Yeah, thanks very much. Jonathan, you happy with that?
Yeah, absolutely. No, fine. Thank
you. Mark, Tanya, I just wondered, one of our key questions is what areas require, we've mentioned about improvements during the course of the pandemic. Which areas do you think would require further consolidation to become effective in similar circumstances? I.e., what are the learning points? Are there any quick learning points, or will we need to take a much more deeper dive into the whole affairs? But have you thought of anything that, yes, that's something we need to put in place so we're ready should it happen again?
So, I mean, clearly there's always going to be learning points from these scenarios. So I think a couple of key ones for me, and certainly in terms of delivery of my wider adult disability services, but certainly in terms of adult care services, I think Councillor Gordon touched on it earlier, was being much better at having contingency records for unpaid carers and being able to respond quickly, and where we haven't got them, knowing that and being able to have a conversation with unpaid carers about how we are able to respond and build that link. So whilst I think there's key learning in that, I think we've got to get better at having that proactively, so we're not worrying about it at the point of there being incidents or things like pandemics, etc., so that we can build on that. So I think that's definitely one key area for me. I think the other one is social care and social work is intrinsically a people relationship based public service. It is wholly built on the idea of people being together and talking and sharing and understanding and seeing people's body language in being able to do what we do well. And I think that has thrown us a little bit when you're just looking through video technology with individuals who use our support and Hertfordshire citizens. And whilst it's a good thing that we've produced that, it still has major deficits. And I think one of the things we need to think about going forward is, if we rely on it because of other issues or scenarios, or it becomes more the norm, how do we still make sure we deliver a very person-centred, relationship-based service to the citizens of Hertfordshire that can be felt on both sides? So I think there are two key areas that will fundamentally change, I think, probably how we deliver our work, but we must make sure that we remember that a lot of what went before was very good, and we don't just want to go with the flow of new technology and miss out on the stuff that made us really good.
Thank you, Mark. And can I say I very much welcome that phrase, and I think that should be carved on a plaque. Still need the personal touch. I think, because technology and artificial intelligence is rapidly gaining ground. It's good as a support or an emergency measure, but I don't think anything gets, well, personal approach. I don't think anything is a replacement for the personal relationship which exists with the vulnerable person. So, however, right, we're nearly there, folks. I've got another 5 minutes. Has anybody got any last burning questions, or does anybody else want to say anything else that they might want to? No? Right. Oh, Mark, yes.
So, Councillor, I suppose I wanted to mention one of the things we haven't actually reflected on, but I just wanted to share in case there are any questions, was obviously adult mental health social care services. Yeah. So they are delegated responsibilities from us to HPFT. And I suppose I just wanted to put on record that everything we've talked about today, we also share with HPFT, and we have some very clear governance set up so we can work with them to ensure they're able to follow up on their strategic safeguarding as well as we do in ACS. So I just wanted to be clear that we extend what we do in adult care services to our partnership with HPFT, because they fundamentally for this purposes are us when they deliver the adult safeguarding element. And obviously adult mental health has come with other pressures that are slightly different to other individuals, and I think our colleagues in the police force mentioned some of those earlier. But being able to reach out for people that may be more isolated, living on their own, reliant on that personal, clinical and social care response has been quite key. I know colleagues in HFT have done quite a lot to push that work forward as well, in conjunction with us and with Tanya's oversight.
Thanks so much, Liz. Have you got any comment on what Mark's just said about HPFT working partnership?
No, I completely agree. I mean, there is a very strong partnership, and I know that within the safeguarding arena as well, that there's a strong working partnership between Tanya, Keith and HPFT and the staff within there in relation to the referrals and inquiries and investigations and the joint work between the two. So there is a very good, strong partnership. And actually, it's those sort of partnerships that raise issues. So I know that the at some point, literally probably last month, the HPFD, it was identified that their concerns that were identified, which escalate into inquiries safeguarding, had dropped down to 22%. So it was raised as, actually, why has that dropped down? So that was one of the data that was presented to myself. So again, I had that conversation, and I think it was still Ian McBeath, as to why is that dropped down to 22%, because that's dropped down from 50%. So I know that was escalated, and a great deal of work has taken place with HPFT in conjunction with Tanya and Keith's team. And I know that's now gone back up again, and it was more to do with the computerized system. But it's those sort of things that are, when they're identified, they can actually be picked up very quickly, and escalated to be resolved, really.
Lovely. Thanks very much, Liz. Tanya, I'll let you have the last word on this one.
Thank you. Thank you. Do you know what? It was just to say how hugely relieved I was to hear what you just said in your role, to have said what you did about technology being there as a backup and not as a replacement for social care, for social work. And you know what? That's partly because even when we're talking amongst ourselves as workers, technology can let us down. So like this meeting, I've got a flashing background, so you can't see me nodding, shaking my head. You can't see all of the, the collaborating I can do without speaking. That's cut out, and that happens to us, a good deal of the time. That happens to us. But certainly in terms of social work, social care practice, our work is relationship based, and you can't form a relationship with somebody on screen in this way. So I'm just really pleased to hear you say that, Councillor. Thank you.
Thank you very much, Tanya, and I assure everybody else that it won't influence what I say. Thank you very much. Anyway, thank you, Mark, Tanya, and sorry Chris couldn't be with us, but no doubt he's doing something equally essential and important. And anyway, thank you very much. And from the whole of the panel, can I say a personal thank you to you guys in the adult care service, is because you, together with the public health people and, well, everybody else really, all the staff members have done such a fantastic job over the last 10 months that I think, well, I better stop there, otherwise I shall end up getting political. But I hope recognition will come sooner or later about the work that the care services have done. So I'll leave it at that. I think. Right, thanks very much, folks. Right, we're more or less on time. I'm very pleased to see. We're going to have another 10-minute break, and then we'll reassemble at 4 in order to discuss our summary and any recommendations that we're going to be making. So if anybody could put their well, you're having another cup of tea, if you could put your thinking caps on, and I'll see everybody back here at 4. Thanks very much.
Fiona, are we live now, or are we waiting to hear from IT?
I'm just waiting for confirmation from IT.
Right. Well, give me the shout when
we are sorry. We're live now.
Right. Hello, welcome back, everybody. Right, the summary and conclusions. Can I suggest, perhaps Liz, if you'd like to have a last word, and then I'll go round the panel.
Chairman, the usual process is that you ask your scrutiny officer to summarise the group's deliberations.
I was thinking of giving Liz the last minute, and then we'll start off with you, Natalie, and then go around the panel. I just wanted to see if Liz had any other bits to add to what others have said during the course of it.
Yeah, I don't think so. Thank you, Ron. I think there's been some good questions. So really, for me, I think it's just to make what we've done more on a footing, more of a perhaps a strategic footing. But I just wanted to really to note just the work of the business unit. I know there's been a lot of talk today about the board and what the board does, but actually the majority of the work takes place by Mary and Eva and Jean from the business unit, who work so hard to support all the subgroups and all the boards to make sure that the policies are written and sent out. So I just really would like it noted, and my big thanks for all the hard work that the board does undertake on behalf of myself, really.
Okay, that's fine. Right, Natalie, right, over to you.
Okay, just a final summary. I think the group has done amazingly well in a short period of time to have gathered so much evidence and addressed the key lines of inquiry that were on the scoping document. So I think it's been a good piece of work this afternoon. I wasn't sure how easy it was going to be for members to get to the end of this with some good conclusions, and I think it's been fantastic. So I'm just going to walk you through the key aspects that emerged during the scrutiny. Liz very helpfully reminded everybody about the purpose of the board and the fact that it was established officially with the 2014 Care Act. I do think Hertfordshire was ahead of the game under Sarah Pickup, because there'd already been a board of this nature in existence, which then just became a formalised process and met the criteria of the Care Act. So I think that that's always put HCC and Hertfordshire and its partners in a stronger position. Moving specifically now into the COVID impacts that you heard from the independent chair of the board, that there was a move to streamline the groups and look at the work of the board to provide capacity to partners who were being stretched in other directions as well, but to ensure that safeguarding adults continued along with that regular work. And you heard that within the first week there was a COVID website available, so that enormously helped the partners ensure safeguarding took place. You also heard that a care providers helpline was initiated, and that Liz was involved in the care cell, which included care homes and learning disabilities, and that a review of care homes took place, which you were later told to that point had not taken place elsewhere in the country. That Liz and the board initiated that following what was happening in Hertfordshire, and obviously that's been helpful to other areas of the country. So it's quite good to hear that kind of two-way street of activity. That you heard from Liz that the board ensured with partners that safeguarding continued to be a priority, and actually even in spite of everything else that partners were taking on, that they were open to challenge, and that when she contacted agencies to raise concerns there was an immediate response, and that there was a frequent contact between the independent chair and the partner agencies of the board. You heard that fortnightly meetings that were instigated to replace other activities were both started before the 23rd of March lockdown, so measures were already in place and ready to ensure that our most vulnerable citizens were safeguarded as much as we could possibly ensure. Learning about what was going on was that findings for any reviews will be recognised and inform future work. In response to a member question around communication with the public, you were informed that a carer has joined the comms group, which will help shape that information and how it's distributed. You heard that learning occurred from the first lockdown, which then informed how the second lockdown was handled, and additional learning came out of that second lockdown, and that the September board was held differently to accommodate the needs in place at that time, but just to ensure that business was conducted in a streamlined process, but undertaken efficiently. You heard very much from the police, and then this was picked up again through other presentations in the afternoon, that the strength of the response during COVID is down or hugely attributable to the strength of the relationships that exist between the board and its statutory members and other agencies that are all involved, and the relationships are well embedded. And his phrase was "without being too cosy," which was a point I'll come to later that Liz reflected back onto. You heard how the CCGs, etc., were using technology to adapt, and so were the police in terms of contacting people, ensuring that messages were getting out, that the people were being protected and liaised with, using virtual technology and the phone to replace in-person meetings. But when in-person meetings were required, they continued to take place. There was an awful lot that I'm skipping through because there was a wealth of information, so I'm just trying to pull out the key nuggets for that. You heard that the police modelled some scenarios of what it would be like with a 30 to 40% staffing absence, which other agencies also did, but actually, in fact, those absences were never that great. And for the police, that meant that they could keep those specialist teams together, because members did challenge that and were concerned that if a member of a safeguarding team was unavailable, whether that meant that there was a lack of knowledge and understanding of the issues. But in fact, that you heard that was not the case, and you heard from the operational lead that they delayed any staffing transitions where a member of staff was due to join a new team elsewhere within the constabulary. Those were delayed to ensure that the team response was robust. You heard from Jane Kinnebear when you moved on to the NHS, and she reiterated what the constabulary had contributed in terms she saw herself joining a well-established system, that the level of questioning was very open and honest, that holding to account was taking place, that members of the board understood the risks and individual responsibilities that fell to them and that they had to undertake, and that the CCGs undertook their responsibilities of reminding NHS providers that statutory safeguarding duties continued during COVID. This was not to be ignored or forgotten. You heard that the NHS in February set up an incident control centre for cascading of information and updates, which seemed to work well from their point of view. You heard from the NHS from CCG that they maintained their training programme and that it was delivered virtually. And from their point of view, that actually improved attendance, that they got attendance across the board perhaps in a way that they wouldn't have done. That lessons learned were about maintaining professional curiosity and asking the kinds of questions that you would under normal circumstances, that professional curiosity was key to safeguarding practice. But but just to have at the back of your mind who else might be in the room. And I think this was in response to a question that a member asked, that there needs to be a vigilance, particularly around domestic abuse and cuckooing, those kinds of activities, that if you don't know who else is in the room, you don't know whether the quality of the answers you're getting are the ones that you can actually work on. In terms of lessons learned, there was the timeliness of the response, the need to respond quickly, collaborative working really took off. Well, that's not fair. Collaborative working was already taking place, but what you did here was how that was accelerated and consolidated during COVID in terms of ensuring that vulnerable people were protected. Then you heard from Adult Care Services, Department of the County Council, again acknowledging that the clear, strong lines and arrangements in place and accountability enabled the practice during COVID to work as well as it did. You heard about the care home from Tanya, the care home cell, about that enabled the sharing of good practice, but it was also a forum for accelerating issues and actually ensuring that any of the local resilience forum cells fed into safeguarding. So there was that kind of virtual circle of information being shared. I think one point very well made by Adult Care Services was actually the lack of recognition that was taking place in terms of people with learning disabilities. They seemed to kind of dip below the radar, but what I thought was really helpful from Tanya's presentation was that they detailed what they'd put in place, which you'd also received in Liz's report in terms of ensuring that a group was put in place to work with people with learning disabilities. And then you heard from ACS just the kind of accountability role that the board and the independent chair in particular play in terms of challenging ACS for further information around domestic abuse, and that picking up the do not resuscitate was picked up early, and measures put in place in the authority to ensure that that wasn't adopted as a blanket approach, and where that did seem to be an avenue that certain agencies or care homes were undertaking, that was rapidly prevented from becoming a permanent response. You heard that the review of care homes was not a finger-pointing exercise, but actually to identify the issues and learning from that, very much as would be in the Sarah's case review that the board would undertake in different circumstances. I also thought it was helpful that Mark went through medication errors and kind of clarified when something is a minor issue and when something is a serious issue, and actually that there have been work in hand to create a different protocol, but COVID actually accelerated that and meant it got addressed more quickly, which the benefit of that was the kind of lesser bureaucracy that people had to deal with, but it's actually become a permanent improvement. So I think when Jonathan I noticed was kept asking about when efficiencies and improvements were being asked, and I think that fitted in quite well in terms of there was an improvement alongside the virtual training that has been a consequence of that. I think also the quality of the board that you were able to interrogate today, and I think the quality of Liz's leadership within that, because you heard throughout the police, the CCGs, talking about the effectiveness of the board, the way that there are frank and open conversations, but clearly held in a way that enables people to participate fully in those without feeling that they're being criticised unduly. There is an understanding of the issues that people face, and that then develops a more open approach. People don't try to disguise where things aren't going. So I think Liz's role within that, as she says, she has a pack that the board, her expectations of any board member are clearly outlined, and that she follows that up in a one-to-one, and then that's reinforced at a one-to-one a month later, clarifying how issues are concerned and her expectations of board members, and also her role in, again, what Constabulary said previously about partners not getting too cosy, and her exhaustion that she expects when somebody comes to, when an organisation comes to the board, that the other members of that board won't leave the scrutiny to her. The other board members will be bringing their levels of expertise and understanding, and similarly have that 360 challenge of one another. You asked about new measures that were working perhaps better. Well, we've outlined a couple of those, and you've heard about using Teams for team meetings. You heard from the police that, you know, they were able to hold more meetings and get to the subgroup meetings because they weren't driving around the county trying to find somewhere to park. So that will be something that continues in the future. But I think, as was mentioned by Tanya, that can't completely replace the importance of maintaining in-person meetings. If you're a people-led service, to have everything happening remotely by technology doesn't seem quite congruent with what you're doing. So I think the issue for the board and adult care services and any other service that's involved in that frontline approach to work is how you get the judicious balance of the savings from not travelling around the county, but making sure that you get your people out to those key individuals who need more help. Now, members, you're not going to perhaps like this, but I don't really think you you identified any recommendations. This is not novel, because it's happened before with the adults, with the Children's Safeguarding Board. The areas that, if you were minded, I would suggest that you would want to follow up some of the commendations that you made yourself around the board and the activities that have taken place. The areas which were flagged up toward the end of the scrutiny can either go into the conclusions, or you can consider whether you do want them as recommendations, were Mark's comments around contingency planning, so that is done in advance and not done at a point of crisis. So that could be a recommendation that you would want. I think you could articulate something around getting that balance between the use of virtual technology and in-person meetings, so that considers to be part and parcel of the work of the Safeguarding Board. And you were assured that safeguarding processes extend to HPFT. My only caution around why I was saying about recommendations is you just need to be mindful that this is a piece of scrutiny not about the partners and the way that they deliver services, but about the board itself. And have you assured yourself or not that actually during the pandemic the board adapted its behaviour and continued to safeguard individuals? So that would be my differentiation. I'm not saying about the quality of those recommendations not being negligible, but it's actually about are they consistent with the scrutiny? So I will pause there and hand back to the chair.
Natalie, before I rest of the panel, first I can clarify that my comment at the end of the meeting, which Tanya, someone's got there not muted. The comment I made at the end of the meeting, which Tanya reinforced about the technical should not abolish the personal, was referring to adult care services and the replacement of individuals being visited and looked after and being left with just a machine or telephone visits. So it wasn't about the conduct of meetings. My comment, and Tanya, and that's why I think Tanya reacted so well, was I was concerned about the future provisions of adult care services, and that we should also always maintain the personal touch, and we shouldn't just rely on telephone calls and technology to look after people, especially if on their own. So it's not about meetings, that was about provision of services. So get that one. Now, I've got several. First of all, I think we can make some recommendations. There's the one Liz mentioned about cuckooing, where clearly identified that the board has got some work to do on that, that Liz wants to do a deep dive on that. So I think we can we can congratulate the board while at the same time recommending that a report comes back to us next year or whatever it is, saying how did you get on with your views on cuckooing. I think it was Tina or Dee that picked up on the point about domiciliary care and isolation, and I think that's an area where we perhaps might want to consider. Certainly one of the I think again it was Dee picked up on the PCN, the primary care networks and GP's performance, and the interaction between the board, and we might want to ask further questions about that. Staff welfare is always one I would like to mention. You've mentioned learning difficulties yourself, and I would also like to ask and put down a marker that when we come back next year to do this, that we would like to have a pre-attendance at a board meeting so that we can see the board in operation before we go into the topic group. So that would be a recommendation for how we run next year's group. But apart from that, I'll pass over, and if I go along the road, Dee, would you like to comment on anything?
Thank you, Ron. No, I totally agree with what you've just said, and I think it's been a really good topic scrutiny. We seem to have covered a range of subjects today, and you know, I was, to be honest with you, it brought it all home to you how hard the staff have been working behind the scenes. So no, I fully endorse what you've said.
Thanks very much. Tina.
Sorry, I was just trying to let the cat out. who decided it was far too cold and didn't want to go out. Yeah.
Hasn't got a vote.
I'm absolutely in agreement with what you said, Ron, and I hope that the points that Natalie has made, I'm taking up my point about the contingency plans that Mark mentioned, will be incorporated into our list of recommendations. And I do hope that the board find them useful and that we'll get some useful feedback. And I really think your suggestion is an excellent one about when this scrutiny takes place next year for members like myself to be able to attend a board meeting. I think that would give us some great background.
Tina?
I totally agree with everything that you've said, and I think Rita, I agree with you that a visit to the board meeting would be a very valuable thing to do. But I'm amazed at how much work was actually put in very quickly at the beginning of the pandemic, and how everybody just pulled out all the stops to get things going properly. No, properly is not the right word. Consistently, perhaps, would be the better word to use. Thank you.
That's something that should also be mentioned in the report. Jonathan, you got any comments?
Yeah, I think that, you know, we're very fortunate that actually the Safeguarding Adult Board in Hertfordshire is very, very good, and they reacted very, very quickly to the changing situation earlier this year. And I think we should give them more praise for doing that. Learning disabilities and cuckooing, yes, it does stand out a little bit, whether that should be in a recommendation or whether it should be in some form of a conclusion, but I'm happy with that. I think the fact that we can learn from the pandemic, as Liz was talking about, and you know, she has better meetings now on one-to-ones, but when you want to get 30 people together using the virtual system is not great. But I think she's aware of that, so we can you know, suggest that they build on those strengths for next year, hoping when there won't be a pandemic, but also the contingency planning, that if the pandemic continues or there's something similar another time, we're ready for that. And I think they very much will be ready for that if they carry on with their current progress. So yeah, I'm supporting most of what's been said.
Can I say then, rounding up that I think, Natalie, what we'll do is, if you do your usual scribe's effort on everything, I would suggest we have at least at least 3 comments. Whether or not they're recommendations or not is another matter. Possibly the cuckooing should be a recommendation, because that is something that Liz herself said that she wants to make further efforts on. So I think that supports what Liz said, and then that's something we can check on next year. So I think that would be good. And I think it's such an iniquitous and horrible thing, and that affects our residents, that I believe that's something that we should encourage the police and everybody else to do all they can to put a stop to it. So no, I'm in favour of that. The learning difficulties, I wasn't entirely sure what we were getting at. So them dropping below the radar means that we didn't really ask the right questions. So that's something I think we were at fault because we should have pursued that a bit more ourselves.
John, Ron, I was meaning that actually for much of the population, people with learning disabilities didn't. I wasn't suggesting for a moment that the topic group hadn't been aware of that, nor that witnesses had disregarded. It was just an observation more about what was happening more broadly.
Yeah, no, I think we did concentrate on the health and the care home system, and I think we did. I take that point on board myself and admonish myself for that. And I do think possibly they need a mention, whether or not it's a formal recommendation or whether or not it's just something that we need to advise on. And then the domiciliary care and isolation, because we've heard Liz talk about the self-neglect. And of course, isolation begets self-neglect, and so therefore I think that's something as well. So what I'll do, I've actually got about 11 pages of notes, literally. So what I'll do is I'll try and unscramble that lot into some form and let you have it in the next couple of days, or as soon as possible. And
I don't know if Liz had got any last comments or thoughts that she would share with you.
I was going to ask Liz to come back. So I was thinking about the formalities. So I'll let you have a properly written copy of my notes, culled down into the essentials. But Liz, yeah, it's a good idea. Do you want to sort of end on anything?
Yeah, thank you. I just wanted to cup on a couple of things, really. I think what we mentioned about the statutory partners together, and I think you actually questioned me on it about the statutory partners and how there was issues that were raised during the fortnightly meeting, and I think something to do with that might be helpful about putting that more on a formal basis. So some sort of formalised escalation process for statutory partners, just in case something happens again.
Yeah, I think my comment was you described the system so well, and I said, well, yeah, and then how does everything feed through and how quickly is it? And you said you can cut across it if you've got something urgent.
Yeah.
But I think possibly you could be right there that we may want to formalise the structure so that everybody understands their roles in it and their responsibilities and the requirements that, we are not playing at this safeguarding. It's a serious business, and that everybody, you want to put a form of words together, Liz, and pass them over to Natalie, and Natalie can take a look for the inclusion in the report.
Yeah, I just think that would be really handy. I just think because God forbid we get something like this in the future, and it might not be this, it might just be some disaster in Hertfordshire, I don't know what, a plane or something. It might be good to have a policy in place that if this happens or something similar happens, we can pull together statutory partners, and this is what's expected, and this is how we escalate concerns from each partners on a statutory basis. So I think that would be really helpful.
I think in actual fact you're perfectly right, because after all, as a county, we are supposed to actually have emergency plans in place for all sorts of things, major road crashes and everything, where you get a gold commander, a silver commander and a bronze commander, and everybody knows what they're doing, and all you have to do is you reach into the desk, you pull out the envelope, and there you are, you've got the instructions on how to do it. So I think you're perfectly right. We can certainly work on that and put something together, and that would be a good outcome from this.
Yeah, I think so, and I think also my only concern about and yes, cuckooing the board, that's one of our board's priorities for next year anyway. So we're working on that, and I'm more than happy to bring that back to you to an update of what we've done and what we've achieved.
Yeah.
The only concern I'd have about domiciliary that you were talking about is that the board doesn't actually own that. That's owned by Adult Care Services. So I'd be a bit concerned about a recommendation for the board on that.
Okay, I think then we'll just make it a note in our report.
Yeah, so, if you could, because I'm not sure how the board could do it, if you know what I mean, because it's not, we don't own it. So that would be my only concern on that one.
And I would suggest, Ron, that you've got a number of members who sit on health scrutiny here. Actually, your speediest and most effective routes for picking up some of those issues would be through the Health Scrutiny Committee. Yeah. And in fact, you've got ICS coming back later this month. Yeah. So you can actually raise some of those issues with them, and hopefully they'll be able to give you answers there, or if not, they will be able to do it at a later meeting or through a briefing note.
I find it useful in this format that if it's a concern, and so if we have it in the narrative of our report, then we can just make a note of it, and then we've got a note of it for raising at future, and we can actually refer to this topic group and saying it was raised at this topic group. So we want someone to pay attention. I think it gives added weight to it, but I accept what Liz says about it's not necessarily a board responsibility. Yeah. So if everybody's happy with that, thank you, troops. We're only.
Can I just clarify for people what next steps are? Particularly, I'm thinking of anybody who hasn't been through this process before. Is that final wording of the recommendations will be agreed by the chair. Draft report will be prepared of the findings from today and how any recommendations are substantiated by what you've heard today. And that will then come out to all of you for consideration. You'll have a deadline by which to respond, so I will be trying to work to that quite tightly, because obviously the sooner you can get your report out, the better it will be. We've talked about agile working in this scrutiny, so it'd be quite helpful if we could also deliver on that as well. And what will happen is that the recommendations from this will be considered by the Impact of Scrutiny Advisory Committee in 6 months' time, so that Liz will be expected to provide responses to those recommendations, and they will be signed off by that committee if they're happy with the progress to date, or they will return to that committee another time. I would also like just some clarification whilst you're still here in terms of which recommendations are now still on the table, because I've got various bits being added and crossed out. So just want to make sure that what I've got is the right there. So it sounded to me as though when you'd heard from Liz about cuckooing, you'd heard it's already a priority, and so therefore I was not quite clear if that continued as a recommendation, or having heard from Liz, it had now fallen back to the board to get on with that.
No, I think we recognise the board's work on it. I'll develop a form of wording, but that we consider it so important that we would like to monitor the progress, and so therefore we would like to ensure that it comes back next year or something like that. Obviously, we can't expect the board to deal with it tomorrow. It's going to probably be 6 months to a year before, but certainly I would like.
So I've got that confirmed as a recommendation. The attending of the board. I mean, what usually happens, and Liz will know this because it was her suggestion back in the day, is that under normal processes, all of the members of this topic group are invited to a board meeting prior to this sitting. So I'm going to suggest we have that as in the conclusion, actually, that you'd just like to see that going on. Business issues. I don't think you need it at the rest.
It is to be regretted that the pandemic has prevented the topic group from attending a board meeting.
Okay.
I'll make sure you get invited to the board next at least a month before.
Thank you very much.
And then what is the contingency planning? Is that continuing as a recommendation, or is that something?
I think so. Okay. Liz is going to give us some wording for that.
Okay. And PCNs and domiciliary isn't a recommendation.
No, but that needs to be covered in the text of the report.
Yeah. But that Liz's points about formalising escalation process around statutory and fortnightly.
That's what we've to. That's what Lizzie's going to.
So I just wanted to confirm so that those are the recommendations, are they? So that would suggest you've got like 4 recommendations.
Well, I think something like that. It sounds good. Does everybody else agree with that? Nod. Okay, so I'll start getting wording sorted out for those, and then get the draft report out to you as soon as we're able to do that. Thank you, Ron. Thanks, Natalie, and thank you, everybody. And it's great. I think the 5 of us have been together a few times, and I think we're forming a very efficient team. So thanks very much, and look forward to seeing everybody again soon.
Yes, thank you very much.
Thank you. Thank you for all your
work.
help.
Bye.
Thank you very much.
Cheers. Bye-bye. Thanks, Natalie and Fiona and Mary as well. And so that's it, I think. Thanks very much. Cheers.